may I request all the delegates and special invitees, please stand up and give a huge round of applause to Honorable Chief Guest, Guest of Honor, special guest, all respected speakers, moderators, and all dignitaries. Thank you so much, everyone. You may have your seats. A very warm good morning to Galaxy of Intellectual, Your Excellency, invited Chief Guest, Guest of Honor, special speakers, moderators, principal and all teaching and non-teaching faculties, and my dear delegates. On behalf of Shree Krishna Institute of Nursing, on behalf of Shree Krishna Institute of Nursing, I, Nikhila R. Nair, faculty of this institute and organizing secretary of this conference, delights to offer a gracious and glorious welcome, and I feel privileged to welcome you all to the first national conference on theme Challenges and Innovations in Nursing Education. Well, Dean William R. Inge once said, the aim of education is the knowledge not of fact but values. It is on occasion like this we get opportunities to test our knowledge and understanding. We look forward to get an exposure about the best of the brain things about this very dynamic topic, that is challenges and innovation in nursing education. We are honored to have you all today with us as we embark on this incredible journey of knowledge, innovation and collaboration. This conference serves as a platform for experts, researchers and professionals to discuss breakthroughs, share experience and foster meanings connections. Before we proceed, Once again, a very warm welcome to all of you. Talent and skills are the crop that are nurtured, groomed, and given all possible opportunities to grow and bloom. Without taking much of your time, permit me to start the program. It is our culture to remember God Almighty before everything we do or start so. Let us begin this national conference by seeking the blessing and presence of God Almighty. For the same, I would like to call Miss Hiral and group to come over the stage for welcome dance. Miss Hiral and group.
वक्रतुण्ड महाकाय सूर्यकोटि समप्रभ निर्विघ्नं कुरु मे देव सर्वकार्येषु सर्वदा।
गणनायकाय गणदैवताय गणाध्यक्षाय धीमहि गुणशरीराय गुणमण्डिताय गुणेशानाय धीमहि गुणातीताय गुणाधीशाय गुणप्रविष्टाय धीमहि एकदन्ताय वक्रतुण्डाय गौरीतनयाय धीमहि गजेशानाय भालचन्द्राय श्रीगणेशाय धीमहि
एकदन्ताय वक्रतुण्डाय गौरीतनयाय धीमहि गजेशानाय भालचन्द्राय श्रीगणेशाय धीमहि
गानचतुराय गानप्राणाय गानान्तरात्मने गानोत्सुकाय गानमत्ताय गानोत्सुकमनसे गुरुपूजिताय गुरुदैवताय गुरुकुलस्थायिने गुरुविक्रमाय गुह्यप्रवराय गुरवे गुणगुरवे गुरुदैत्यकलक्षेत्रे गुरुधर्मसदाराध्याय गुरुपुत्रपरित्रात्रे गीतसाराय गीततत्त्वाय गीतगोत्राय धीमहि गूढगुल्फाय गन्धमत्ताय गोजयप्रदाय धीमहि गुणातीताय गुणाधीशाय गुणप्रविष्टाय धीमहि
सर्वराजाय गन्धाय सर्वगानश्रवणप्रणयिने
एकदन्ताय वक्रतुण्डाय गौरीतनयाय धीमहि गजेशानाय भालचन्द्राय श्रीगणेशाय धीमहि एकदन्ताय वक्रतुण्डाय गौरीतनयाय धीमहि गजेशानाय भालचन्द्राय श्रीगणेशाय धीमहि
Wow, really it was a highly devotional performance. Thank you, Hiral and group, for creating heavenly atmosphere here. Lighting the lamp and pray is in a way an invocation of the waves of knowledge that are activated on stage. It also means keeping the waves of knowledge generated on the knowledge imparting stage constantly active through the medium of the flame of the lamp and prayer. To make this morning a blessed one, invoke Goddess Saraswati by offering flower and prayer of knowledge and wisdom. For seeking the choicest blessing, for the same I invite all the dignitaries, please come forward and offer flowers on Goddess Saraswati and praise Goddess for the success of this conference. I request all the dignitaries, please come forward for offer the flowers to Goddess Saraswati. Like to request all the dignitaries, please come forward and kindly occupy the seat on the dais. I request all the dignitaries, speakers, moderators and guests to please come forward and kindly occupy the seat on the dais.
शमशीरों से ही हो
तीर्थ
Hospitality makes our guests feel like home. We should welcome them, make it happen. In many cultures, the act of welcoming holds a special place, and today we have chosen a timeless tradition to extend our warm regards to all the guests, speakers, and moderators as we gather here. We are not just witnessing the event, we are creating a memory, and it's our pleasure to share it with each and every one of you. So, I would like to also invite Mr. Deepak Chakrabarti sir, Head Operations of Nadabet Indo-Pak Border, for welcome our guests, moderators and speakers on behalf of Nadabet Indo-Pak Border. Over to you, sir.
Thank you, ma'am. Good morning, all the delegates present on the dais and all the lovely students out there. Nadabet Indo-Pak border welcomes you all here and wish to thank the management of Krishna Institute for choosing us as the venue for your conference. We are truly privileged, sir, to host the conference here at Indo-Pak border. Before we actually begin the conference, I would like to extend a very big thank you to our special guest of honor here, Deputy Commandant Mr. Ritesh Ranjan from 194 Battalion BSF. Sir, it is because of you and your troops that we live in peace, because you stand there at the border guarding all of us. On behalf of the countrymen, we truly appreciate your work and thank you very much, sir. Nadabet Indo-Pak border management would also like to thank and felicitate all the delegates present here through our way of offering shawls and mementos for all the delegates, which we would be carrying out in just about time. Last but not the least, I would suggest all the students out here to pay attention to the conferences, because these conferences perhaps are not part of your syllabus or book study, but you will gain a lot of knowledge from these type of conferences, which will add to your portfolio, and you will learn many things which would require you to go and excel in your respective professional fields. So I would once again request all the students to kindly pay attention and not treat it as any other conference. Okay? I wish this conference a huge success, sir. Thank you so much. Thank you.
Thank you so much, sir. So next, we are having felicitation for our guests, our speakers and our moderators on behalf of Shree Krishna Group of Institute and on behalf of Nadabet Indo-Pak border. So, I would like to call, first of all, I would like to call respected Shri Sartan Bhai R. Desai sir to please give bouquet and token of appreciation on behalf of Sri Krishna Group of Institution to the Honorable Guest of Honor Mr. I.A. Kadiwala sir, Vice President of Gujarat Nursing Council, Ahmedabad.
झुकाए जा रख हौसला कर फैसला तुझे वक्त बदलना है
And I would like to call Nadabet Indo-Pak border team to felicitate I.A. Kadiwala sir, Vice President of Gujarat Nursing Council, Ahmedabad. Next, I would like to request Mrs. Damini Soni ma'am, please come forward and present bouquet and token of appreciation on behalf of Shree Krishna Group of Institute to Honorable Guest of Honor Dr. Pragna Dabi ma'am, Registrar of Gujarat Nursing Council, Ahmedabad. I would like to request Shri Shivram Bhai R. Desai sir to please welcome and felicitate Mr. Ritesh Ranjan sir, Deputy Commandant BSF 194 Battalion BSF. I request Shri Shivram Bhai R. Desai sir to welcome Mr. Ritesh Ranjan sir, Deputy Commandant BSF 194 Battalion BSF. Thank you, sir. Next, I would like to request Professor Dr. Jibin Varghese, sir, Principal of Shree Krishna Institute of Nursing, to present bouquet and token of appreciation to Shri Sartan Bhai R. Desai, sir, President of Shree Krishna Group of Institute. Thank you, sir. Now next, I would like to request Shri Babu Bhai Rawal, sir, to please present bouquet to Shri Shivram Bhai R. Desai, sir. Thank you, sir. Now, I would like to request Mr. Rishabh Upadhyay, sir, to please give floral welcome to Professor Dr. Jibin Varghese, sir, Principal of Shree Krishna Institute of Nursing.
गगन झुकाए जा रख हौसला कर फैसला तुझे वक्त बदलना है
Next, I would like to request Mrs. Selvi Radhakrishnan ma'am, please present bouquet and token of appreciation on behalf of Shree Krishna Institute of Nursing to our Honorable Speaker Dr. Indravati Rao ma'am, Principal of Government College of Nursing, Surat, Gujarat.
अनुज पांडा
Next, I would like to request Mrs. Renu Susan Varghese ma'am, please present token of appreciation and bouquet on behalf of Shree Krishna Institute of Nursing to our Honorable Speaker Dr. Shweta Joshi ma'am, Professor and HOD of Child Health Nursing Department, Dr. D.Y. Patil College of Nursing, Pune. Request Shri Purushottam Bhai R. Desai sir, please come forward and present token of appreciation and bouquet on behalf of Shree Krishna Group of Institute to our honorable guest, Speaker Mr. Manish Sharma sir, Assistant Professor of College of Nursing, AIMS, Rishikesh.
Hello.
Next, I would like Next, I would like to request Professor Jibin Verghese sir. Next, I would like to request Professor Jibin Verghese sir, please present token of appreciation and bouquet on behalf of Shree Krishna Group of Institute to our Honorable Speaker, Mr. Atul Sharma sir, Assistant Professor of Institute of Nursing Education and Research, AIMS Batinda.
तेज उस तरह करेंगे मुश्किलों से हम परहेज किस तरह हमारी और ही हवा को मोड़ के जिएंगे जम के जीना चाहे जिस तरह ओ यारा अपनी डिग्रियां बनाएंगे आड़े टेढ़े रूल्स हैं जो वो सारे तोड़ के दिखाएंगे
रूठी तकदीरें तो क्या टूटी शमशीरें तो क्या टूटी शमशीरों से ही हो
Next, I would like to request Ms. Anita Desai ma'am, please come forward and felicitate our Honorable Speaker Ms. Priyanka Pandey ma'am, Chief Coordinator of Pragya Simulation Center, Parul University, Vadodara. Next, I would like to request Shri Raghubhai Joshi sir, please come forward and felicitate and give honor to Honorable Moderator Dr. Dayalal Patidar sir, Principal of Jyotiba College of Nursing, Bhandu, Gujarat. Sir. Next, I would like to request Shri Hitendra Trivedi sir, please come forward and felicitate to our Honorable Moderator Dr. Vijay Kumar Gautam sir, Principal of IKDRC College of Nursing, Ahmedabad, Gujarat. Next, I would like to request Sri Babubhai Rawal sir to please come forward and felicitate our honorable moderator Dr. Rakesh Patidar sir, Principal of Government College of Nursing, Sidhpur, Gujarat. Next, I would like to request Mrs. Shanta Chaudhary ma'am, please felicitate our honorable moderator Dr. Karpagovalli Nageshwaram ma'am, Principal, Faculty of Nursing, Ganpat University, Mehsana, Gujarat. Thank you, ma'am. Next, I would like to request Professor Jibin Varghese sir, please felicitate our honorable moderator Mr. Ravi Barot sir, Associate Professor of Faculty of Nursing, Ganpat University, Mehsana, Gujarat. Next, I would like to request Professor Jibin Varghese sir and Shri Shivram Bhai R. Desai sir to felicitate Mr. Deepak Chakrabarti sir, Head Operations of Nadabet Indo-Pak Border. Please welcome sir, Deepak Chakrabarti sir. I would like to request Professor Dr. Jibin Varghese sir to felicitate Shri Purushottam Bhai R. Desai sir and welcome him. I request Professor Dr. Jibin Varghese sir to welcome and felicitate Shri Purushottam Bhai R. Desai sir. request Professor Jibin Varghese sir to please felicitate Dr. Shri Babubhai Rawal sir and welcome him. I would like to request Professor Dr. Jibin Varghese sir to please felicitate Shri Raghubhai Joshi sir and welcome him. I request Professor Dr. Jibin Varghese sir to please felicitate Shri Hitendra Trivedi sir. Next, I request Professor Dr. Jibin Varghese sir to please felicitate Shri Shailesh Nai sir and welcome him. Thank you all, and special thanks to Nadabet Indo-Pak border team for this precious felicitation. After this warm felicitation, I would like to welcome all of you with a welcome speech. For the same, I request Professor Dr. Jibin Varghese, Principal of Shree Krishna Institute of Nursing and Chairperson of this national conference, please come forward to deliver the welcome address. Sir is presently working as Principal of Shree Krishna Group of Institute. He is passionate, enthusiastic and energetic personality. He is capable, profounding, qualified and dedicated. He is a role model. Sir is so humble and make himself accessible to all. Sir, please come and welcome our dignitaries, speakers and moderators with your valuable and humble words. Over to you, sir.
Good morning, everyone. Honorable guest, distinguished speaker, moderator, and all delegates here. A very warm welcome to all of you to this prestigious national conference on challenges and innovation in nursing education. It is my distinct pleasure and privilege to stand before you today as we commend this significant gathering of brilliant minds and experts from various fields. I am delighted to see such a diverse and accomplished gathering of nursing educators, students, practitioners, researchers, and policymakers here today. I would like to express my gratitude to all participants who have traveled from different parts of the country to attend this conference. Your presence here stands testament to your commitment to knowledge, research, pursuit of excellence. I certain that your contribution and insight will enrich the discussion and deliberation over the course of the conference. This conference serves as a platform for intellectuals, scholars, researchers, students, and practitioners to exchange ideas, share their research findings, and explore innovative approaches to address the challenges faced in the respective field. I am confident that this gathering will foster collaboration, foster new connection, and pave the way of breakthrough in various disciplines. The theme of the conference is Challenges and Innovation in Nursing Education is of utmost relevance in today's ever-evolving world. Throughout this conference, we have esteemed speakers who will share their knowledge, expertise, and experience. Their insight will undoubtedly shed lights of the complexities of theme and inspire us to push the boundaries of our understanding and explore innovative approaches to address the challenges that lie before us. This conference embodies that spirit by bringing together diverse perspective and discipline under one roof. By sharing our expertise and perspective, we can contribute to the greater good and collectively work together a better future. I would like to take this opportunity to thank the organizing committee, our faculty members, and the support staff for their relentless efforts in making this conference possible. This dedication and hard work behind the scene have ensured the event runs smoothly and successfully. I encourage all of you to actively participate in this session, engage in fruitful discussion, and seize the opportunity to learn, network, and create lasting connection. Remember, the impact of this conference extends before this wall and has the potential to shape the future of our respective field and contribute to the progress of our nation. Once again, welcome to this national conference on challenges and innovation in nursing education. I wish you all a productive and intellectually stimulating experience. Thank you and Jai Hind.
Thank you so much, sir. Thank you all of you for gracing us with your presence. We are privileged to have such distinguished personalities among us who have significantly contributed to their respective fields and continue to inspire countless individuals worldwide. As we move forward, let's acknowledge that this conference is not just about listening to great ideas, but also about engaging in meaningful discussions. We have an exciting lineup sessions throughout the day and presentations allowing you to delve deeper into specific areas of interest and interact with experts from various domains. Now, without further delays, let us begin the national conference where minds will meet, ideas will collide, and solution will be born. To inaugurate this remarkable event, I would like to invite our estimated guests and all the speakers, moderators, and all the dignitaries to kindly come forward and inaugurate the conference with press button on the remote and draw curtains and unveiling theme of the conference. Big round of applause. Thank you, sir and ma'am. Now I request all the respected dignitaries to kindly sit off the dais and join us for the next session of the conference. I request all the dignitaries please kindly sit off the dais and join us for the next session of the conference. Please give them a big round of applause as they leave the stage.
Thank you.
celebration of new and small steps we have taken towards spreading love. So, ladies and gentlemen, now it's time for keynote address. So, I would like to call upon Dr. Pragna Dabi ma'am, Registrar of Gujarat Nursing Council, to please come and address the gathering by your precious word. Please welcome ma'am. Over to you, ma'am.
Good morning, all. Respected Kadiwala sir, Vice President Gujarat Nursing Council, Satan sir, Parsotam sir, Sivaram sir, all esteemed speakers, moderators, principal of this institute, Jibin sir, all faculties, officers from NABET organization, and dear participants. First of all, I would like to congratulate Krishna Institute of Nursing and its entire team for organizing such a informative and innovative information. Heartily congratulations to the institute. Secondly, I will say that it is a really unique experience for nursing profession. Rather, I can say that it is a matter of pride for nursing profession that this conference is organizing at this Nadabet Indo-Pak border. So I really thank you to officers and organization of the Nadabet that they have permitted us, and because of that we are here. I am also thankful for the Krishna Institute and organization for the same. When we entered here, we feel really it is the innovative experience. It is really unique one. And if it is unique one for us, definitely I can say that it will be unique one for all of you. It will be definitely memorable experience for all of you, as it is a border space. We learn many things, we can see many things, we learn discipline, we see many things, we feel proud, and simultaneously we will get knowledge and wisdom. So all of you are very lucky. I can say that I am also lucky, all the delegates are lucky, and all of you participants are lucky that we are part of this event. So congratulate to all of you. Indeed, this is historical conference and a really unique experience. If I say something about the topic of this conference, yes, it is the need of an era. Nowadays there are many changes took place in the nursing profession, in education, in practice side, and I can say that there are many legal changes too. So really a good topic, innovative changes in nursing education. So you will learn many things from here. Esteemed speakers are there, esteemed moderators are there. They are coming from far away to teach us, to discuss very important aspects of nursing profession with us. So I hope that all of you will learn many things from here, and whenever you go, you will share your learning with your colleagues wherever you are working, or your batchmate. You can share this knowledge with them. See, as far as nursing profession is concerned, practical aspects are very important, and I am very, very happy that 3 sessions, I think 3 sessions are there for practical aspects, for simulation, for demonstration, and for nursing lab. So I hope that you will learn very good things from here. On my left side I can see advanced mannequin 2. So I have very, very much hope from this conference. So whenever you go at your institute, you try to learn these all things, because we say nursing, so we are connected with the human being. So simulation is very important for learning in our profession. So I hope you will learn and you will implement those things in your career, and you will provide better care to our patient through your.
ભારત માતા કી વંદે. આજના આ કોન્ફરન્સમાં ગુજરાતી બોલવાનું, મોદી સાહેબ એ જ કરે, અમે બધા ભૂરિયાઓ અમે. ભાષા અગત્યની નથી, તમે શું બોલો એ અગત્યનું છે. જેને રણમાં માં સરસ્વતીનું ધામ ઊભું કર્યું છે એવું આ પરિવાર, એટલે કે સરતનભાઈ દેસાઈ, શિવરામભાઈ અને પરસોત્તમભાઈ, જો ભગવાનના જ નામ છે. અને ગુજરાત નર્સિંગ કાઉન્સિલના ખૂબ ડાયનેમિક અને તદ્દન જુનિયર બાળક હોય કે સિનિયર ફેકલ્ટી હોય, સૌની સાથે લઈને ચાલનાર એવા ડાયનેમિક રજિસ્ટ્રાર ડૉક્ટર પ્રજ્ઞાબેન ડાભી મેડમ. આ સંસ્થાના ટ્રસ્ટીઓ હિતેશભાઈ ત્રિવેદી, રઘુભાઈ જોશી, બાબુભાઈ રાવલ, ત્રણે ત્રણ બ્રાહ્મણ છે. સાથે સાથે ભીષ્મ પિતામાં કહીએ અમે પાટીદાર સાહેબ, દયાલાલ પાટીદાર સાહેબ, રાકેશ પાટીદાર સાહેબ, સુરતથી ડૉક્ટર ઇન્દ્રાવતી રાવ મેડમ, સ્વાતિબેન જોશી, જેઓ ત્યાંથી આવે છે, ડીવાય પાટીલ બોમ્બે, તાળીઓથી બતાવીએ, મહારાષ્ટ્રથી આવે, વિજયકુમાર ગૌતમ, ત્યાર પછી છે મહેશ શર્માજી, જેઓ ઋષિકેશ એમસી, એમને પણ આપણે સ્વાગત કરીએ ગુજરાતમાં. રાકેશ પાટીદાર સર તો પૂર બાજુમાંથી જ છે, અમારા મિત્ર છે. અતુલ શર્માજી જે એમ્સ ભટિંડાથી આવેલા છે, એમને પણ આપણે આવકારીએ તાળીઓથી. પ્રિન્સિપાલ ગણપત યુનિવર્સિટી નાગેશ્વરન મેડમ, ત્યાર પછી છે પ્રિયંકા પાંડે, એ પારુલ ઇન્સ્ટિટ્યૂટમાં આવ્યા છે, અને રવિ બારોટ સર અમદાવાદ. સાથે સાથે દરેક કોલેજના પ્રિન્સિપાલશ્રીઓ, ફેકલ્ટી, અને જેને એવું કહેવાય ને કે ભારતીય સંસ્કૃતિ પ્રમાણે વેલકમ, સ્વાગત, અને વિદ્યાર્થીઓએ ખૂબ મહેનત કરી છે કેટલા દિવસથી, એના પ્રિન્સિપાલ આપણા જીબીન સર અને એમના ધર્મપત્ની. ખૂબ અદ્ભુત. અમે 200 જેટલી કોન્ફરન્સ જોઈ, પણ આવું સ્વાગત ક્યાંય નથી જોયું સાહેબ. સરતાનભાઈ આખો દેશ ફર્યા, પણ કોન્ફરન્સની ક્વોલિટી જો, બાળકો પણ એકદમ મસ્ત શિસ્તબદ્ધ રીતે ફરશે પણ ખરા ને જ્ઞાન પણ લેશે, એ રીતનું આ કોન્ફરન્સ છે. અમે ઘણી બધી કોન્ફરન્સ દેશમાં જોઈ, પણ હવે જે શિસ્તબદ્ધ રીતે બાળકોએ જે ઉમળકાભર સ્વાગત કર્યું છે અમારા મહેમાનોનું, અને શ્રાવણ માસમાં હું આપ સૌને વંદન કરું છું. 200 જે ત્યાર પછી આ એવું કહેવાય ને કે આ વિસ્તારમાં સૌથી પહેલી આ કૃષ્ણા ઇન્સ્ટિટ્યૂટ, ત્યારે શિવરામભાઈ નર્સિંગ કાઉન્સિલમાં નહોતા, પણ સરતાનભાઈનું જે આ વિઝન હતું સાહેબ, 5-6 વર્ષ પછી જ્યારે અહીંયા બોર્ડર કોઈ જોવા આવશે ને, ત્યારે આ કોલેજના વિદ્યાર્થીઓ પીએચડી ને એમએસસી થઈ, અને આજ સંકુલમાં એમને એવું સમજાવશે કે યુ કમ હિયર એન્ડ સી ધીસ ઇન્સ્ટિટ્યૂટ. આવું કહેશે. અમે બધા તો જઈએ ને, બધા અમારા નસીબમાં એમએસસી, હું પીપીબીએસસી નહોતું સાહેબ, પ્રજ્ઞાબેન એક જીએનએમથી ક્યાં પીએચડી સુધી ગયા, પહેલાં પીએચડી છે રાજ્ય સરકારના. આજે હું શંકરભાઈ ચૌધરી સાહેબ આ માનનીય મહામહિમ અધ્યક્ષશ્રીને યાદ કરું કે એમના કાર્યકાળ આરોગ્ય મંત્રી દરમિયાન ગુજરાતને જે એમને વિઝન આપ્યું છે સાહેબ, ત્યારે જ અમે લોકો આ સ્ટેજ પર છીએ. ડૉક્ટર પ્રજ્ઞાબેન ડાબી એમનું ઉત્તમ ઉદાહરણ. મેડિકલ કોલેજ બનાસ આ વિસ્તારમાં ઘણી બધી નર્સિંગ કોલેજો એમને એ લાવ્યા આખા ગુજરાતમાં. પહેલાં આપણે બેંગ્લોર અને એની પર આધાર રાખવો પડતો હતો. આજે એમના સફળ પ્રયત્નો, એમના સુકાન હેઠળ 2016માં જે કોલેજો આવી અને ગુજરાતનું વિદ્યાર્થી જ્યારે છેલ્લે બેઠેલી દીકરી કે દીકરો 5 વર્ષ પછી કોઈ પણ સ્ટેજ પર હશે ને, ત્યારે આ કોન્ફરન્સની સફળતા કહેવાશે સાહેબ. આપણું બાળક ખૂબ આગળ વધી રહ્યું છે. કોવિડ વખતે પણ બાળકોએ ખૂબ મહેનત કરી. બાળકો તો અત્યારે પાસ થઈને બહાર નીકળી ગયા, કોઈ એમએસસીમાંથી નીકળ્યું, કોઈ બીએસસીમાંથી નીકળ્યું, પણ વિદેશમાં પણ અમેરિકા, લંડનમાં પણ ભૂરિયાઓ સામે આપણું ગુજરાતી બાળક ધૂમ મચાવે છે. અને એના માટે હું જો ક્રેડિટ આપવાનો હોય તો પાટીદાર સાહેબ છે, રાકેશ પાટીદાર સાહેબ છે, આખું જે રાજસ્થાનનું ગ્રુપ છે, કર્ણાટકનું ગ્રુપ છે, એના માટે એક જોરદાર તાળી થઈ જાય. તમારા જીબીનભાઈ સાઉથમાંથી ઉત્તરમાં આવ્યા ત્યારે આજે શ્રાવણમાં આપણે ભેગા થયા. શિવરામભાઈ અમારા પરમ મિત્ર, પોતે એડવોકેટ છે, ખૂબ શાંત, કશું જ બોલે નહીં. કાઉન્સિલ મિટિંગમાં આવે તો બહુ જ ઓછું બોલે, પણ જ્યારે બોલે ને ત્યારે એટલું વજનદાર બોલે કે જે ખૂબ પ્રભાવિત હોય. પોતે 2 સંસ્થાઓમાં છે, ફૂડ એન્ડ વેજીટેબલ છે, ગુજરાતનું ફેડરેશન છે, તેના સરકાર નિયુક્ત મેમ્બર છે, એટલે કે ડિરેક્ટર છે, અને ભારતીય ટિબેટ જે શહેર મંચ એમાં પણ એક મેમ્બર છે. અને 600 વિદ્યાર્થીઓ છે આ કોલેજમાં સાહેબ. આ વિસ્તારને આવનાર વર્ષોમાં શું ડેવલપ થશે મેં જોયું કે આ મને એવું લાગતું હતું કે હશે હવે નાની સંસ્થા હશે ને આપણે જવાનું છે બોર્ડર પર જરા ચક્કર મારવા જવાનું છે. આ તો બોર્ડર આખા દેશને ચક્કર મરાવે અમને હું પોતે ચક્કર ખાઈ ગયો કે આટલા બધા ડેલિગેટ્સ થઈ અને આ રીતનું. અને ડીવાય બધા જો તમે એકદમ સ્ટાર, બધા જ આજના જે તમારા સ્પીકર છે અને મોડરેટર છે એકદમ સ્ટાર છે. એના માટે જોરદાર તાળી થઈ જાય. શંકરભાઈ ચૌધરી સાહેબ જ્યારે આરોગ્ય મંત્રી હતા ત્યારે ડૉક્ટર પ્રજ્ઞાબેનના નેતૃત્વમાં આખા દેશના બધા જ ભણેલા ગણેલા રજિસ્ટ્રારો અમદાવાદમાં આવેલા અને ત્યાર પછી ટ્રેકિંગ સિસ્ટમ ચાલુ થઈ. ગુજરાત એવું સેન્ટર છે, એવી નર્સિંગ કાઉન્સિલ છે કે દેશમાં નંબર 1 પર છે. ટ્રેકિંગ સિસ્ટમ થઈ અને આ કાર્ડ પણ વેચવાના ચાલુ થઈ ગયા. બધું જ ઓનલાઈન. આખી કાઉન્સિલ ડિજિટલ કરવાનું જો શ્રેય જતું હોય ને તો શિવરામભાઈ અમારી ટીમમાં છે. પ્રભાકર સાહેબના માટે જોરદાર તાળી કે એના નેતૃત્વમાં કાઉન્સિલ ડિજિટલ થઈ. ડૉક્ટર અનિલ નાયક સાહેબ આજે ત્યાં આરોગ્ય મંત્રી શ્રી આવ્યા છે, WHO ડિરેક્ટરને બધા છે, એ બીજી છે, પણ આ કોન્ફરન્સને શુભેચ્છા પાઠવી છે. પ્રભાકર સાહેબે પણ શુભેચ્છા પાઠવી છે. પરંતુ ગુજરાત નર્સિંગ કાઉન્સિલના એક મેમ્બર એ ગુજરાતને સમૃદ્ધ કરવામાં નર્સિંગ ક્ષેત્રે ખૂબ પ્રયત્ન કર્યા છે અને એ પ્રયત્નો આજે આપણે દેખાય છે. આપણા બાળકો ગુજરાતમાંથી ક્યાંય એમ્સમાં નહોતા લગતા. પાટીદાર સાહેબ તમારા બાળકો ગયા ને એમ્સમાં બંનેવજનના, આખા દેશમાંથી ગુજરાતમાં છેલ્લા 5 વર્ષમાં 60 કે 62થી વધુ દીકરા દીકરીઓ એમ્સમાં લાગી સાહેબ, એમ્સમાં. અને લગભગ 200થી વધુ છેલ્લા 7 વર્ષમાં દીકરા દીકરીઓ લંડન, અમેરિકા અને ઓસ્ટ્રેલિયા અને કેનેડા ગયા છે. આ છે ગુજરાતનો સિનેરિયો. મારી દીકરા દીકરીઓને એટલી વિનંતી છે કે તમે જે સંસ્થામાં અભ્યાસ કરતા હોય સંસ્થાનું નામ રોશન કરો અને ભૂરિયો સામે આવે ને એની સામે અંગ્રેજી પણ એટલું કડકડાટ બોલો કે ભૂરિયો કે ભૂરિયો કે તમે ભૂરિયાની ભૂલ શોધો કે ભાઈ તું અંગ્રેજી બરાબર બોલ્યો નથી ને એને ગરબા ગાતા પણ શીખવાડો. આદરણીય વડાપ્રધાન સાહેબે આજે આખા ગુજરાતને નહીં પણ આખા દેશને આજે દુનિયાના નકશા પર ક્યાં લાવીને મૂકી દીધું છે સાહેબ. વિઝન તો જુઓ. આવનાર 5 વર્ષ મળશે તો આપણે પાકિસ્તાનમાં ગુજરાતીઓ કોન્ફરન્સ કરશું સાહેબ. આ હકીકત છે. આપણને જોમ જુસ્સો આવો છે આપણા શિક્ષણનો. મને એવું લાગે છે જ્યારે અહીં એન્કરિંગ થતું હતું સિસ્ટેમિક રીતે બાળકો એક મેડિકલ કરતાં પણ વિશેષ જગ્યાએ આપણે બેઠા છે. ઘણા બધા એવું કહે કે મેડિકલ છે, MBBS છે, તમે બધાને જ પાછળ પાડી મૂક્યા છે. નર્સિંગને જે સ્ટડી એના દરેક ટીચર્સો, એના પ્રિન્સિપાલો, ગુજરાતમાં જે વિકાસ થઈ રહ્યો છે એ એક્સિલન્ટ છે. અને એના માટે હું પ્રજ્ઞાબેન ડાભી મેડમને આખી કાઉન્સિલની ટીમને અભિનંદન આપું છું અને તમામ પ્રિન્સિપાલશ્રીઓ. અને પાટીદાર સાહેબ હવે તો પેલું આવવાનું એનએનએમસી, એટલે પેલી જે એપાર્ટમેન્ટમાં ચાલતું હોય એ બંધ થશે, કૃષ્ણા જેવી જ ચાલુ રહેશે. સરતાનભાઈ ચહેરા પરનું નૂલ કોઈ એક આર્મી ઓફિસર જેવું લાગે, પરંતુ જ્યારે અમને પહેલી વાર મળ્યા ને ત્યારે મને લાગ્યું કે આ વ્યક્તિમાં કંઈક છે. અને સાહેબ તમે કંઈક કરી બતાવ્યું છે. કૃષ્ણા જેવી ઇન્સ્ટિટ્યૂટ આ વિસ્તારમાં આપી, રણમાં તમે મા સરસ્વતીનું ધામ ઊભું કર્યું છે. અને લોકો હજુ આવનાર 5 વર્ષ પછી તો લોકો અહીં કેટલું ટુરિઝમ ડેવલપ થશે, કેટલું બધું ડેવલપ થશે. અને પાકિસ્તાનવાળા જોતા હશે કે કૃષ્ણા ઇન્સ્ટિટ્યૂટ અમારી બોર્ડર પર છે તો ત્યાં દર્શન કરવા જાઓ, પણ એના માટે પણ મોદી સાહેબની એમને પરમિશન લેવી પડશે. ફરીથી આ કોન્ફરન્સને શુભેચ્છાઓ આપું છું. અને ઇન્દ્રાવતી મેડમ છેક સુરતથી આવ્યા. પ્રજ્ઞાબેનના નેતૃત્વમાં ઉત્તર ગુજરાતની એક કોલેજમાં વર્લ્ડ રેકોર્ડ થયો કેન્ડલ લાઇટિંગનો. અને પાટીલ સાહેબની ઉપસ્થિતિમાં ઇન્દ્રાવતી મેડમે એક ઇન્ડિયા બુક ઓફ રેકોર્ડ કેન્ડલ લાઇટિંગનો કર્યો. આવતી વખતે કેન્ડલ લાઇટિંગમાં અમે અહીં આવશું બધા. અને આ 500 મોટો હોલ રાખો તો આખા ગુજરાતના વિદ્યાર્થીઓ એ ભેગા થાય અને આખો દેશ દેખે. અને આજના આ મેસેજ આખા વર્લ્ડમાં જશે. સાહેબ અમારી એક ક્લિક લાખો લોકો જોતા હોય છે, એક ક્લિક. અને આ ઇતિહાસ છે. 200થી ઉપર કોન્ફરન્સ જોઈએ છે. સરતાનભાઈ આવું સ્વાગત ભારતીય સંસ્કૃતિ પ્રમાણેનું બાળકોએ કેટલી મહેનત કરી છે, નાની સરખી ભૂલ પણ નહીં. ગણેશ વંદના જુઓ તમે. માતાજી દરેક બાળકોને, જે કંઈ કોલેજના દરેક બાળકોને વિશ્વના ભૂરિયાઓ કરતાં વિશેષ જ્ઞાન પ્રાપ્ત થાય અને દેશમાં નંબર 1 લાવે એવી પ્રાર્થના સાથે વિનવું છું. ભારત માતા કી જય. વંદે માતરમ.
Please maintain silence. Thank you so much, sir, for your marvelous words. Next, it's our great honor to have you with us today. I know you didn't need any introduction because you are sculpture of humanity. So far, enlighten us with your words here. So may I take the pleasure of requesting our respected Shri Sartanbhai R. Desai, sir, President of Shree Krishna Group of Institute, to please come and address the gathering by your precious words. Over to you, sir.
બોલો ભારત માતા કી. સ્કિનકોન 2023 નેશનલ કોન્ફરન્સમાં આપ સૌનું સ્વાગત છે. જેના કારણે આ કાર્યક્રમ શક્ય બન્યો એવા સૌ વિદ્યાર્થી મિત્રોને આ કાર્યક્રમમાં આવવા માટે હું લાખ અભિનંદન આપું છું. અમારા કાર્યક્રમના ચીફ ગેસ્ટ અને પારિવારિક જેનાથી નાતો છે એવા આ સંસ્થામાં ખૂબ મદદ કરી છે એવા ડૉક્ટર કડીવાલા સાહેબ, બેન પ્રજ્ઞાબેન ડાભી જેઓ ગુજરાત નર્સિંગ કાઉન્સિલના રજિસ્ટ્રાર છે અને કૃષ્ણા નર્સિંગ કોલેજને હર હંમેશા પોતીકું ગણીને એમને જે ઉપયોગી થાય છે એવા બેનશ્રી શિવરામભાઈ દેસાઈ, અમારા વડીલ મુરબ્બી દયાલાલ પાટીદાર, નામથી બધા લોકો એમને ઓળખતા હશે, સ્ટુડન્ટ પણ બધા ઓળખતા હશે. અને ઉત્તર ગુજરાતમાં નર્સિંગમાં બહુ ઇફેક્ટિવ રોલ છે જેમનો એવા ડૉક્ટર પાટીદાર સાહેબ, રાકેશ પાટીદાર, આપ સૌ સ્પીકર્સ, એમ્સ પટેન્ડા, એમ્સ ઋષિકેશ, ડીવાય પાટીલ કોલેજ, પારોલ યુનિવર્સિટી અને મહેસાણાથી આવેલ સૌ સ્પીકર્સ એન્ડ મોડરેટર્સ, આપ સૌ એક અલગ પ્રકારના સ્થળમાં આ એક કાર્યક્રમ યોજ્યો છે. આપણે જ્યારે કાર્યક્રમ પૂરો થશે ત્યારે તમે બહારનું વાતાવરણ ફીલ કરશો, જોશો, તમને ખૂબ મજા આવશે. આ ભારતની સરહદ ઉપરનો કાર્યક્રમ છે કે જ્યાં ભારત પાકિસ્તાનની બોર્ડર અહીંથી 20 કિલોમીટર છે. પેલી બાજુ પાકિસ્તાન છે, આ બાજુ ભારત છે. આ જ કાર્યક્રમ 2-3 મિત્રોએ મને સજેશન એવું આપેલું કે G20ની અંદર મહાત્મા મંદિરમાં તમે ફર્સ્ટ નેશનલ કોન્ફરન્સ કરો તો વધારે સારું રહેશે. મેં જોયું કે મારા વિસ્તારના વિદ્યાર્થીઓ જ્યાં વધારે મને મળે, ખાસ કરીને ઉત્તર ગુજરાત અને બનાસકાંઠા જિલ્લો, તો એ એમના માટે નવું એક પેલું કહેવાશે અને નવી રીતે એ લોકો ભાગ લેશે. એટલા માટે આ કાર્યક્રમ આપણે અહીં કર્યો છે. આપ સૌ જાણો છો કે પહેલી હરોળમાં જે લોકો બેઠા એ સમગ્ર દેશમાં અલગ અલગ ક્ષેત્રમાં પોતાનું જ્ઞાન બાંટવાનું કામ કરે છે. એ કોઈ સાધારણ વ્યક્તિ નથી. અને આપણે અહોભાગ્ય એટલા માટે કહેવાય કે આ બધા લોકો પોતાનું આટલા મોટા ક્ષેત્રમાં પોતાના આટલા વ્યસ્ત કાર્યક્રમમાં પણ આપણને જ્ઞાન પીરસવા માટે આવ્યા છે. અને એનું સંકલન કરીને બધા લોકોને ભેગા કરીને આ કાર્યક્રમ જેમણે કર્યો છે એવી મારી કૃષ્ણા નર્સિંગની ટીમ, શ્રી જીબીન વર્ગીસ અને સૌ સ્ટાફ, દામિનીબેન અને મેડમ, હિતેશભાઈ, બાહુભાઈ, પરસોત્તમભાઈ અને રઘુભાઈ, અમે તો માત્ર નિમિત્ત છીએ. અડધો કલાક આવ્યા, તમને બધાને વાત કરી અને નીકળી ગયા. પણ જે સાચો શ્રેય છે એ ફેકલ્ટી મેમ્બર્સ અને ટ્રસ્ટીઓનો છે કે જેણે આ કોલેજમાં આટલા સુધી મહેનત કરીને એક સરસ મજાનો કાર્યક્રમ કર્યો. મિત્રો, મારે આપ સૌની વિનંતી છે કે અહીં જે તમને સ્પીકર જે લોકો મળ્યા છે એ એકદમ વિચક્ષણ બુદ્ધિવાળા લોકો છે, જેમની પાસે 10 મિનિટની વાત કરવી એ પણ ગૌરવ ગણાય, જેમની સાથેનો ફોટો લઈને સેલ્ફી પાડવામાં પણ આપણને ગૌરવ અનુભવાય એવા લોકો છે. અને છતાં પણ આપણા કાર્યક્રમને માન આપી અને જે આઈએનસીમાં પણ કડીવાલા સાહેબ મેમ્બર છે, આપણે સૌને ખબર હશે, અને એ પોતાનો ટાઈમ આપીને જ્યારે આપણે અહીં આવ્યા છે તો સંપૂર્ણ સમય આપણો સ્પીકર અને તમારા સેશનમાં પૂર્ણ થાય. બધા લોકો પોતાની નોટબુકમાં નર્સિંગની અંદર જે ચેલેન્જિંગ એન્ડ ઇનોવેશન ઇન નર્સિંગ એજ્યુકેશન જે તમારા સબ્જેક્ટ છે એના ઉપર પૂરેપૂરું જ્ઞાન પ્રાપ્ત કરો અને ખૂબ સારી રીતે આ કાર્યક્રમ સફળ થાય એવી આપ સૌને શુભકામનાઓ. જ્યારે નીકળો ત્યારે કૃષ્ણા નર્સિંગ કોલેજ એક આંટો મારીને જજો. છેવાડાના વિસ્તારમાં પ્રામાણિકપણે આ વિસ્તારના વિદ્યાર્થીઓને નર્સિંગ ક્ષેત્રે ખૂબ સારું શિક્ષણ મળે એવા પ્રયત્ન કરીએ છીએ અને ભગવાનને ઈશ્વરને પ્રાર્થના કરીએ કે પ્રયત્ન અમારો બેસ્ટ સાબિત થાય. એ માટે પણ આપ સૌ અમને સપોર્ટ કરજો. પારોલ યુનિવર્સિટી અને મહેસાણાથી જે લોકો આવ્યા છે એ લોકો પણ અમારી કોલેજમાં નાની મોટી મદદ કરે. એકદમ રિમોટ એરિયામાં ખૂબ મોટું સાહસ બધા લોકો જે બાંધકામમાં અને બાકીની વસ્તુમાં ખર્ચ કરે એના કરતાં ડબલ ખર્ચ કરીને વિસ્તારના નર્સિંગના બાળકોને સારું શિક્ષણ મળે એના માટે પ્રયત્ન કર્યો છે. ક્યાંક નાની મોટી એકેડેમિક અમારી ભૂલ હોય તો અમને પોતાના ગણીને દયાલાલ સાહેબ સ્વીકારીને ખૂબ સરસ અમને મદદ કરજો એવી સૌને શુભકામનાઓ. વિદ્યાર્થી મિત્રો, તમારા માટે આવનારો સમય એ ચેલેન્જિંગ સમય છે. એ સમયની અંદર તમારે વાત સાહેબે કરી કે ગુજરાતમાંથી એમ્સમાં 60 લોકો ગયા. હવે તમે સ્પર્ધા કરો કે નર્સિંગ પાસ આઉટ થયેલા વિદ્યાર્થીઓ કેટલા અને એમાંથી માત્ર 60ની સંખ્યા એમ્સમાં જાય. હું માનું છું કે આવનારા સમયમાં ગુજરાતમાં 5 એમ્સ આવવાની છે. જોકે જાહેરાત આવી ન કરાય પણ 5 એમ્સ ગુજરાતમાં આવશે એવું પણ પીએમ સાહેબનું એક વિઝન છે કે ગુજરાતની આરોગ્યની સ્થિતિ જે છે એ ખૂબ સારી રીતે આગળ પેલી વધે એના માટે પણ એ પ્રયત્ન કરે છે. ત્યારે કમસે કમ ગુજરાતની એમ્સમાં તો બધા ગુજરાતના બાળકો હોય અને એમાં જે હોલમાં 500 લોકો છે એમાંથી તમે બધા હોય એવી મારી શુભકામનાઓ. ખૂબ સરસ કામ કરો અને ખૂબ સરસ નર્સિંગના પ્રોફેશનમાં આગળ વધો એવી શુભકામનાઓ. ભારત માતા કી જય. વંદે માતરમ.
Thank you so much, sir, for your valuable words, appreciation and blessings. Without further ado, let's start with the most important part of our conference. Moving ahead, we will begin with our first session of the day. Nursing education faces Nursing education faces a range of challenges that impact the quality of training and preparation for the future nurses. So, in the first session, to give us in-depth knowledge regarding challenges in nursing education, we have Dr. Indravati Rao ma'am. Ma'am is working as a principal in Government College of Nursing, Surat. She has more than 18 years of professional experience in clinical teaching and research, administration and management. She got many awards and appreciation in her work tenure. Some are like Best Teacher Award, Best Faculty Award from MTCN Kumari Durg, CG Excellence Work Appreciation Award as a Nodal Officer during COVID-19 first and second phase by New Civil Hospital Surat and TNI Gujarat branch. Ma'am got Appreciation Award from Surat Pediatric Association for the best work. Ma'am has organized state level and national level conferences, workshop, seminar, in-service educations, various curriculum and co-curriculum activity at institutional level, state level and national level. Ma'am has organized and participated as resource person in government funded project, strengthening and development of nurses, staff-oriented programs, induction program, CCCH program, renal training, NPM 3 months training program. Ma'am is a chief editor of Amity Journal and co-editor peer review in many journals. Ma'am is board of study member of UK Tasadia University Surat, PP Samni University, VNSGU Surat and MS University Vadodara. Ma'am is a member of advisory board of CCCH program in IIPH Gandhinagar. She is NQS and Kayakalp assessor. Ma'am is master trainer in various government programs such as Dakshata training, CHO induction training, NQS, neonatal resuscitation, so on. She published more than 20 papers in reputed national and international journals. Chapter contribution in Book of Basics of Nursing Education. She is reviewer of Target High book. She organized largest lamp lighting and oath-taking ceremony which recorded in India Book of Record. Now for the session we have Dr. Dayalal Patidar sir as a moderator. Sir is currently working as a principal of Jyotiba College of Nursing, Bandu. Sir has lifetime membership in TNI, SOMI, Nursing Research Society of India, Indian Association of Neonatal Nurses. Sir has organized number of state and international level conference and workshops. Sir has published many articles and research papers in national and international journals. Sir has attended, participated and resource person in seminar and workshop and many conferences. Sir has done many project and research work also. Sir is ex-dean of Faculty of Medicine in Hem Chandracharya, North Gujarat University, Patan. Sir is chairman of Nursing Board of Studies and Nursing Examination Board of Hem Chandracharya, North Gujarat University, Patan. Sir is member of Board of Studies in Charotar University of Science and Technology, Changa, CU Shah University, Vadhavan. Sir is member of Faculty of Medicine in Hem Chandracharya, North Gujarat University, Patan. Sir is subject expert for teaching staff interview in Hem Chandracharya, North Gujarat University, Charotar University of Science and Technology and Gujarat University, Ahmedabad. Sir is Inspector of Gujarat Nursing Council, Ahmedabad and Hem Chandracharya, North Gujarat University, Patan. Sir is paper setter as well as examiner of Gujarat University, Ahmedabad, Rajasthan University of Health Science, Jaipur, SNDT Women University, Mumbai, Sumandeep Vidyapeeth University, Vadodara, Charotar University of Science Technology, Changa. So I would like to call Dr. Indravati Rao, ma'am, speaker of the first session and moderator for the session, Dr. Dayalal Patidar sir, to the stage with a round of applause that echoes their enthusiasm and anticipation for the transformative insight they are about to share with us. Please give them a big round of applause. Now I am hand over the mic and stage to our resource person, Dr. Indravati Rao ma'am and guide. And I request moderator sir, please take your seat.
Over to you. My slides, you can keep going. Slide. Good morning everyone. Now 15 minutes is remaining to good afternoon. So since morning I have observed here the lots of the innovations are there. innovation in the term of welcome, what we have observed here, and it is the challenges. No, I don't want this. I don't want this. Please keep aside. And the challenges, because we all are here at Nada Bet Indo-Pak border. Jibin sir has given the topic. I feel that this topic is somehow, it is the burning topic. All are agree with this? All are agree it's a burning topic? Because we have to speak regarding the challenges. And if you will see in the nursing, challenges are everywhere. So I feel that in this topic, it's not only the individual or it's my topic. It's a topic of the everyone. So I think so I have the 1 hour. So in this one, yeah, sir said to me before only, you complete your topic, how soon it is possible. But I feel ki here is the time where we all have to do the brainstorming, and when you feel that ki really we are feeling challenges in this concern, in this topic, please discuss, because we want to discuss. Okay? So what topic has given to me is the challenges in nursing education. How I will proceed this topic? So I'm going to proceed this topic by that ki we have to know something about how the evaluation is occur in the healthcare delivery system. The next is, what is the reason why we are facing the challenges? What is the global perspective? Challenges in nursing education, managing challenges, and there are some strategic direction and the policies related to challenges making. Let we see that ki what so far is happened in healthcare delivery system. If you know that in the 2000 United Nations and our GOI, they have done one agreement, and by that they have established Millennium Development Goal. We all are knowing about that Millennium Development Goal. हम सब लोग को पता है इससे related. Okay, one thing I want to ask, whether I will take in Hindi or English. Is it okay or all only in the English? The language? हिंदी हम नहीं पढ़ेंगे पूरा. Okay, थोड़ा सा इंग्लिश तो पढ़ना पड़ेगा. Isn't it? सो यहाँ पे क्या है कि हम सब लोग को मालूम है, जैसा कि मैं डिस्कस कर रही हूँ करके, कि हेल्थ केयर डिलीवरी में सो फार क्या चेंजेस हुआ है. तो मिलेनियम डेवलपमेंट गोल के बारे में वी ऑल आर अवेयर, बट व्हाट हैपेंड इन दैट गोल, देयर वाज ओनली द 8 goals were there, but that goals were not much incomprehensive, not much accurate. Due to that 2015 came, and in that there was not much changes in our healthcare system. Then in the 2015 the sustainable development goal came. So कहीं हम देखेंगे कि sustainable का मतलब क्या होता है करके. So whatever the things we have, whatever the resources, materials we have, that resources and materials we have to keep for our future generation. That is the sustainability. So due to that in the 2015 they have developed the sustainable development goal. अब बात ये है कि sustainable development goal जो है करके ये किस चीज़ों पे वर्क करता है. So mainly the sustainable development goal is working on the 4 pillars. 4 pillars कौन कौन से 4 pillars हैं? We are the people. Okay, one is the people. Second is prosperity. सबका विकास, सबका साथ. That is the prosperity. Next is the planet, and the fourth one is the community participation. So in that it's working. इन्होंने क्या किया? In this goal they have made the 17 goal that will be we have to achieve till 2030. इसमें very beautifully they have said about the third goal, that is health and wellness. The fourth goal is related to the quality education, and the fifth they have given related to gender equity. So these all the things has happened. Here is the things कि why I am discussing regarding MDG or the sustainable development goal, because we are the people. Nurses are playing an integral part in the development of these all the services. So due to that, and because what I feel that our profession is an exciting profession. Do you feel that? Do you feel it is an exciting profession? Because day by day is happening the growth and development in our profession, and it is over or always is the demanding profession. Okay. Afterwards, what happened in the 2018, WHO has given the aim of the universal health coverage under the slogan of health for all. क्वेश्चन यहाँ पे ये आता है कि यूनिवर्सल हेल्थ कवरेज क्या है करके, कोई मुझे बताएगा क्या है यूनिवर्सल हेल्थ कवरेज? Okay, universal health coverage mainly in these, they said that कि all the individual person, community and the family, they will be getting the healthcare services which will be easily accessible, affordable. It is all the person can achieve easily and all the without any financial hardship. So this was the universal health coverage. We the nurses, we are playing integral and the vital role in fulfilling the SDG as well as the healthcare delivery system. In 2018, again, one great changes is occur. What was that changes? We have seen that we people in the urban areas easily we will be able to make available of each and every services. But these services somehow it is not possible कि those people in the rural areas they are not getting the all the healthcare services and it is not easily available. So what our Honorable Prime Minister have done? Our Honorable Prime Minister have started under the Ayushman Bharat. Please change the slide. Please you make it next, okay? Or otherwise you have the presenter. So our Honorable Prime Minister, he had started Ayushman Bharat. In that what they have done, all the sub-center they have transformed. How it will work? No, it will be next. How we will do? Next will be. So all the sub-center is transformed in the health wellness center and he introduced CHO. We all are aware about the CHO. Anyone is here CHO? Oh, great. So mainly what is the work of the CHO? CHO is introduced to provide the health services in the rural areas. Things are going very smoothly as according to our roadmap, what is designed, what to do. One of sudden in the 2019 came, what came? COVID-19. Okay? In the 2019 came COVID-19. We all are the persons already we have observed, experienced the unprecedented situation of the COVID-19 and it due to that what it's happened, disparity in the physically, emotionally, psychologically as well as emotionally. So these all the changes is occur that is in the healthcare sector. Next. Now we will see as a nurses why we are feeling the challenges. What is the reason of the challenges? India is a developing country and the population of the India is 140 crores. So in India still 64.24 persons are living in the rural areas. So there is having the disparity in getting, achieving, making accessible the healthcare services are not there. There is inequality, okay, inequality in the terms of the healthcare services that is not available, shortage of the staffing, changes in the complex health environment. The health environment is day by it's challenging, okay, global warming is there, advanced technologies are there. These all the things is leading, making the things more complex and due to that lots of the challenges are there. Now our patient is also more experienced, they are aware, they are asking about their demand. It's not like that, just we go and we do our work and we come back. They are aware regarding their health condition. They are asking what treatment is going on to me, what you are doing with me. So it's not like that, just we go and do the work as the patient is having dummies. Okay, so these all are the changes and due to these reasons we are facing challenges in our healthcare delivery system. Now here I brought these from the SDNM the global perspective, what and where we are at present. So as according to this global perspective, HDNM 2021 and the 25 reports, that reports had been passed by the World Health Assembly in 28 May 2001. This assembly, they have mainly given the more emphasis on the 4 domains. They said that in these 4 domains, it's a must, it's a required, we have to do the investigate. Okay, it's इस जो 4 डोमेन्स है करके उसमें हमें इन्वेस्ट करना ज़रूरी है करके किस प्रकार के क्या क्या जो डोमेन्स है एजुकेशन, जॉब में, सर्विसेज में एंड द क्रिएशन ऑफ द पोजीशन, because these all the 4 domains are the lacking, and in these 4 domains it's required that we have to do the investment. Apart of that, also they have done the statistics and they find out that what is the condition at present, how much we have the global shortfall of the workforce. So they have seen, उन्होंने observe किया कि क्या है करके before COVID जो condition था कि 6 million we required the workforce, but after COVID already we have seen that कि there was the tremendous changes in the healthcare system. Due to that the workforce is also required to be increased. तो इसके कारण क्या हुआ कि कितना उन्हें requirement की ज़रूरत पड़ी, 13 million जो है करके वो ज़रूरत पड़ा. एक और statistics जो दिया है करके globally nursing workforce, इन्होंने कहा कि at present 27.9 million we have the workforce, and in which if you will see 19.3 millions only the professional nurses. It means somewhere the untrained nurses are there, okay, what we are not knowing. So that is the condition. And even though they have said that as according to the WHO, we required in India 4.3 million extra nurses we required to achieve the goal of the SDG and the universal health coverage by 2030. जैसा कि आप सब लोग को मालूम है, in 2020 WHO had given and WHO has made us given the accreditation that year is mainly devoted to the International Year of Nurse and Midwifery. But what happened? We all were in the COVID condition, okay, due to the euphoric condition of these achievement we all have not enjoyed. Next slide please. Okay, क्या दिख रहा है यहाँ पे? I want कि someone will explain. ये पिक्चर क्या दिख रहा है? This picture I have taken from net. I really see this is a condition of ours. हमारा condition ऐसा है. पिक्चर में क्या दिख रहा है? One nurse is hanging. Nurse is hanging. Doctors are like as a snack in the healthcare system. Management itself is going to cut the tree. ठीक है? And the patient are like as a crocodile barking on us. That is the situation. Okay? So I think so you all are agree. फिर हम कैसे नहीं कहें कि challenges face नहीं करना पड़ेगा. Challenges face करना ही पड़ेगा क्योंकि situation ये है हमारी. Okay? Okay. Next slide please. Now the challenges जो दिया है करके nursing education में, but I feel that these challenges is nursing education means not only education. Clinical is also coming, administration is also coming, and research is also coming. Let we see that what are the challenges we are facing. Next please. Next please. Okay. Now here we will see the concern related to the challenges. What is happened in the 2020? One of sudden our syllabus had been changed. BSc nursing syllabus changed. It is the challenges for the faculty. Those faculties are sitting here. Do you feel that it's the challenges? Ki we are accepted? Still it is the challenges. One thing we appreciate to our regulatory body. Our regulatory body really have done the landmark remarkable in the nursing profession. Whatever the NEP 2020 said, each and everything they incorporated in our syllabus. So what are the highlights of our syllabus? Our syllabus came in the semester system. Now we are giving more emphasis in the competency-based education. Competency-based education, what? It's not, do you feel that कि पहले हम competent नहीं थे? अभी हमें कॉम्पिटेंसी की ज़रूरत है। प्लीज़ थोड़ा सा बात करेंगे, बात नहीं करेंगे तो नहीं होगा। और सर ने मुझे बोला 40 मिनट्स ना सर, है ना, आई विल नॉट। तो प्लीज़, इट्स नॉट लाइक दैट वी वर नॉट कॉम्पिटेंट, वी वर कॉम्पिटेंट। Somehow we are not getting what the competency is. So competency means not only the knowledge, attitude and the practice, but the person is able to perform accurately, real time. The person will be able to take the decision, critical thinking, okay, and as according to the patient requirement, the person will perform. That is the competency. So this syllabus is beautifully given this emphasis on the competency based, outcome based approaches, transformation and the relationship education. Transformation, it means between the student, teachers and the student, having we create the environment, that environment will be happy, healthy and having the learning, teaching and the learning atmosphere. That is the transformational and relationship education. Self-directed learning, credit system, elective and having mandatory modules. Students are having choice, they can select the elective modules and as according to that they can choose and they can do that. Okay. Along with these, they have also added the value-based education. Now recently I have seen INC1 circular came that in that they have said that why don't we teach our student as a foreign language? It's not like that, it is a new, already it was there. I really appreciate some university, and somehow I'm not saying that you are studying under the institution. Institutions also can do the newness and the innovative. But in the university, because there are so many disciplines are there, तो वो discipline में already वो add ही करते हैं value based education. Okay, in terms of the human values, they are teaching to the student. Some foreign languages they are teaching, yoga they are teaching to the dance, music, that all the things are there along with our curriculum. So what happened? One of sudden ये curriculum आया, हम teachers, हम student, first of all teachers were not prepared. Okay, they were not ready to accept. Facilitator were not there, pedagogy were not there. So these all the problems came and we faced these problems. Next please. In this syllabus is also given, as a teacher we have to, as a nurses we should have some core competency. Core competency, they have given the 10 core competency. I'm not going to elaborate here each and everything. So mainly the patient centered. Whenever we are providing care to the patient, we consider patient as a whole. We have to give more emphasis the preference of the patient. Okay, whenever we are providing. So if you will see, as a teacher who is my customer, my students are my customer, I have to see that my student in the which way, what I will do, what I will make, how I will make to teach to them. So the same type of the things I have to take for my student. Next is the professionalism, teaching and the leadership, system based, so on. These all are the competencies are there. This is already given in the syllabus. Next please. Now the challenges, the concern of the challenges related to structure, process and outcome. Structures means infrastructure. We have seen there are the many institutions where they don't have the infrastructure as according to our regulatory bodies, what says, what should be required, that is not there. Equipments are not there, articles are not there, labs are not equipped. Okay, so this is the one problem. The process means how we are rendering our services to our customer, our client. So process, which type of the instructional modules we are using, what pedagogy we are using, what type of the methodology we are using, how we are delivering our services, what is the clinical facility, how we are doing overall development of the student. If both the things will be having somewhere lacking, definitely the output will be lacking. So this is the concern of the challenges we have to take care of this part also. Next please. Classroom technology, where we were and how we have progressed. Before initially, if you will say about the traditional time, in the traditional time we used to use only the blackboard and the chalk. Now, nowhere the blackboard and the chalk our teachers are using. We have changed from that. Now we have transformed our teaching way in the form of smart classes, smart board, whiteboard, digital boards are there, and also COVID made us to learn regarding the virtual classes. So that is also the thing related to these aspects. Next please. This is the very much important. Our next speakers going to enlighten you people and going to make you in the depth regarding the innovative methods of the teaching. Sorry to say, teachers क्या करते हैं class में जाके at present, going in the class, using the one digital way, PPT. PPT is there, okay? लगा दो PPT, लग गया. Now we read the PPT, we will say. We first of all know that to whom we are teaching. ये जिसको हम पढ़ा रहे हैं वो तो हमसे एक्स्ट्रा ऑर्डिनरी हैं, ओके? जो अपने स्टूडेंट हैं, somehow बोलते नहीं है, मे बी डर से. टीचर्स का डर होगा, कुछ होगा, somehow इसके कारण ये बोलते नहीं हैं करके. लेकिन so that's why it's now the topic of concern. It's a topic of need to address. Okay, we have to sensitize to our teacher regarding the different type of the innovative methodology, what we can do, how we can make our classes more interactive, more attentive. Student love to attend the teacher class. Okay, it's not like that bagasa kha rahe ho class mein. It's not like that ki just sitting in the class and doing such type of the activity. Okay, because we have to know that. For that, what to do? Today we have kept the conference related to each and every innovative methodology. We have to keep the workshop. I'm not saying conference. Workshop is required. Hands-on skill is required. Okay, just मैं यहाँ पे बोलूँगी करके कि project based learning है, scenario based learning है, problem solving approaches है, okay, simulation है. सिर्फ मैं बोलूँगी, it will not be effective. Unless I make you to do, I will do. Okay, we have to identify what is the gap, what is the problem that is required. So as according to our new syllabus, it's required that teacher has to change their self. They have to change their attitude. They have to make more innovative, creative. Okay, what new things they will bring in the class. So I'm not going to discuss more. Our next speaker already going to discuss in this topic what we can do. This is the matter of address. That's why I presented here. Next. Blended learning is also the one type of the new approaches, one type of the new innovative strategies. We can use that where we are using face-to-face contact, physical teaching along with the learning, along with the online learning. Okay, physically maybe how we are meeting together, that we can do that. Through the virtual we can do that, but here is required कि our teacher, we have to make sensitize how to use the online, how to give the assignment to the student. Assignment also in the terms of the MCQs question, but how to formulate the MCQs question online. So these all the things is required to teach to our student. Okay, so before that must the teacher has to be knowing about that. They have to be well versed in their content, the way of the delivery, how they will be discussing, how they will be teaching with the student. So each and everything they will be doing that. So this is the new approach. So you all the people, when you get the time, you have to learn regarding the blended learning. So far I'm dealing with these learning pyramid. Learning pyramid, it says that when we are taking the class, we have to know about our student. What type of the learner our students are. It's not like that if 50 students are there in the same way I will teach to all the students. All the students will be able to get and grasp in the same way. No, all the students are having the different. They have the different identity, different intellectual, different way of learning. So as a teacher, I have to identify what type of the learner I have. Okay, I have the audio learner, visual learner, or the global learner. I have to identify, I have to modify my contents, the way of delivery, and then I will give to our student. So this pyramid is itself, it shows that what are the things are there and in which methodology we are doing more interactive, where the student also give their input, their feedback, and they also involved, they also have to do the discussion. Next please. Okay, this is the things, gap between the nursing theory and the practice. You all people are agree कि somewhere gapping is there? Gapping is there? Yeah, madam said rightly. What it's happened, how we are teaching to the student. For example, कि our new already syllabus came. Now we teachers are knowing that कि syllabus is came, these all the things has been incorporated in the syllabus, these all the things are required. Whether the same things, those people in the hospitals, they are aware how we are teaching to our student. Now we are using the new concept. If I say it's not the new OSCE and the OSPE, so here is having the checklist, and based on the checklist we are teaching to our student. Okay, each and everything step wise step, what you supposed to do, what you will not do, when you are doing, what is the reason why you are doing that. Okay, with the logic, with the reason, we are teaching each and everything to our student. What has happened when they are going in the clinical, they are doing the work as according to hospital practice. They are forgetting what we have done, and because they will be in the clinical side more time, so what they are doing in the same way they are doing, they are not doing the critical thinking, they are not taking any type of the real time decision related to the patient concern. So that gap is there. So what we will do, how we will fulfill this gap. So for that, next, for that is required the competency. As I said to you, hands-on skills are required. We have to give more focus, as I said to you, the creativity in the class, because our students also, they want to give the input, they want to communicate openly, they communicate, they discuss. We have to create the environment in such a way they have to feel safe, happy, and they will not feel any type of the burden or hesitation when they are sitting in the class. That we have to develop in the class. So by that we can reduce these by develop the competency. Our next speaker already going to discuss regarding the simulation. The simulation is the one way by that we can do and we can minimize this gap. Next please. Okay, that please show what we are doing at present. This I like it, that's why I put here. 21st century kids are being taught by the 20th century adult using 19th century curriculum and techniques on an 18th century calendar. We are doing the same. Required to be changed, required to be brushed out, required to make more skilled. Something newness we have to bring in the classroom. Next please. This is everywhere it is lacking. Now I will see in this conference, hardly faculties are here. Hardly faculties are here. Maybe the somehow the problem is that because faculties are not getting, if I'll say I am going for the conference, nobody will give leave, or maybe your principal will put extra work on you. Due to that you will not leave the institution and not go for the faculty development program. Somehow it is lacking. Our accreditation regulatory bodies, they are doing the work. They are already said that for our registration, continuing of the registration, we require the 150 credit. But where our system is bother, our system is not bother for the development of faculty. Unless we invest on the faculty, okay, we cannot give the production. Our faculty have to be inspired, motivate, empower to them. They have to be abreast with what at present is going on. So faculty development is also the one concern which is required. As I said to you, we are dealing with the Z generation, smart people. Okay, we are the X generation people. You people are Z generation. The people, they are techie savvy, digital native, whatever, कुछ भी चीज़ चाहिए, already Google Baba is available. The ocean of the knowledge. तो सब चीज़ तो अवेलेबल है, फिर टीचर की क्यों ज़रूरत है? सो टीचर को समथिंग एल्स करना है, कुछ इनोवेटिव, ओके, कुछ क्रिएटिव। अभी ऐसा करना है ना, आपका अटेंशन मुझे ग्रैब करना है, हाउ आई विल grab your attention, that the teacher is required to do. Because now the people are not like that, कि simply I will take the lecture and 45-minute lecture I will complete and go back, okay, the student will not be interested. So we have to use the different type of the methods. We do the group discussion, divide the student into the group, give the small topic, do study by your own, you search, you have to explore the different phenomena related to topic, identify, come back, sit together and discuss it. Okay, because we are discussing with the Z generation people, our students are comes under Z generation people, so that we have to take care of it. Everywhere is having the problem, limited clinical exposure. I am giving example of my civil hospital. 1200 bedded hospital है, आते होंगे 18 से 19 colleges. Just you see that 40 and 50 patients are there. For one patient is having the 6 to 7 student. When we enter in the ward, we are seeing everywhere students are there. Where is the patient? Nobody is guiding to them, nobody is mentoring to them what they will do that. Okay? After that, the doctor's round will be coming, all the students will be going in the side room. They all will be sitting, as I said to you, Z generation people. All people are having the Android mobile. As according to their interest, they will be seeing. Due to that, हो क्या रहा है? क्या generation हम produce कर रहे हैं? Students are not much confidence to perform their work. Okay? They are not able to explore the complex situation. They are not able to do the communication. Sorry, I'm saying that communication is the one big challenge. Just keep mouth shut, going and doing the work. Many times said, yaar, do communication. Your teachers are teaching to you in the laboratory. First things they are saying to you, go and inform to you, explain the procedure to the patient. हम कम्युनिकेशन करते हैं? नहीं करते हैं, हम बात ही नहीं करते हैं. The beautiful tongue is there to talk. Talk. एक ऐसा अब रख लेना चाहिए, बोलना है कुछ भी, whatever, but not irrelevant. हाँ, कुछ भी बोला तो ठीक है, कुछ भी से कुछ भी नहीं करना है. So that is the things, that is the lacking. So this is also the matter of the concern, कि we have to take care of these. And as according to our student, we should have the clinical facility. As in the hospital, 1:3 ratio is required. So 1:3 ratio should be there to make the student more competent, more confidence, and they have to learn कि how to take the real time decision. So that is required. Next please. Technological advancement in the clinical health. Okay, so I think so you all are agree with these, and this technology is the somewhere it is the revolutionary and the boon in the healthcare delivery system. Okay, we nurses, we staffs also, I will say that we are back in these. We are back in these. We are not much knowledgeable, not much abreast regarding these techniques. Okay, so that is also required. It's a sensitized to our faculties, because what happened, no, when we have completed our nursing, that time during schooling also we didn't have computer, नहीं था computer. Nursing में जब आए करके तो first year में computer subject दिया था. Okay, hardly 40 or 50 minutes. Do you feel that 40 and 50 minutes is make us competent to become and handle with all this technology? No, it is not possible. Now they have done one thing is good from the school. Just you see in the NEP, from the school, in Kinder Joy school, they have the computer. They are learning the computer. Then how we will say that? कि being a teacher, if I say no, I don't know how to do this, use the technology, how to do this, the thing. So it's a required कि time to time, whatever the changes are coming, each and everything we have to teach to our faculties as well as the student. So electronic health records, if I say in the corporate hospital, well nice, mannered, they are feeding these all the information And these all the information will be helpful to us to take the clinical decision, to monitor to the patient time to time, to make the accurate diagnosis of the patient, and if you required we can do the research on it. So for that, this is also the level of concern. Time is less, no? Just I'll do it. Next, AI. You all are aware about the AI in the nursing care. Already somehow we all the people are aware. Somewhere some people they are using the chat GPT also. Some days before only I get about the chat GPT, and really I feel very good, because through the chat GPT, whatever we want, what is our question, just we message and the chat GPT is giving the accurate answer related to that. So this is the technology. If I watch, okay, Apple Watch also, so many people have done the research in that the Apple Watch is helpful to reducing the cardiac problem and the neurological problem. So for that, this AI is also born in our healthcare system. Apart of that, there are the some AR and the VR and interoperability, AR and VR. This is also the new technology. As a teacher, we can also use it in the classroom if our management, our government is providing such type of the facility. So we can also use that. This is having the head devices are there, and by that whatever we want we can create it. Just I want to give the one example of the VR, how the VR will be helpful for the healthcare delivery system. For example, if the patient is going for the surgery, before going to the surgery we have to reduce the anxiety level of the patient. What to do? Here through the VR, we have to say to the patient, when patient entered in the operation theater, okay, what position we are going to do, what type of the incision we are going to do, which all the layers we are going to opening, what we are going to do, these all the things before entering to the OT, each and everything we will inform to the patient. So by that it will be reducing the anxiety level of the patient. So this is also the new technology that we can use. Telenursing is also the concern. We have to make our teachers and our nurses also, they have to know these techniques, and where the nursing services is not possible to deliver, there they can, with the help of the telenursing, they can do that. I must recognize here the NIMHANS. During the COVID time, they have started the telenursing, and by that they have identified and giving the counseling to the psychosocial aspect of the COVID-19 patient and the relative. So related to that, they have done the telenursing work. Next please. Disconnect between the clinical nurse and the teachers. Already we have discussed regarding the gapping. So it is the same things here. That's why our regulatory body said regarding the dual role, we have to perform the dual role, so that whatever the upgradation are there should not be any type of the miscommunication, and our student also will not do the wrong practice, and our nurses also not the back knowledge they will be using. Okay, so for that is required. Research, if I'll say regarding the research, so somewhere it is related to these things, whatever the research we are doing in the day by day, whatever the research we are doing, we have to identify how we can implement in our clinical area. Just I want to give the one and the two example here. During COVID-19, we have observed that our patients were having the oxygen deficiency. We all have seen that patients were having the oxygen deficiency in the ward and in the hospital. So along with the physiotherapy department, we have done the collaborative research, and here we have seen that when we will give the prone position to the patient, the consumption of the oxygen is less. So these research we have done. So that's why I'm saying to you, this is also the matter of the concern. We have to identify that somewhere we have the problem because the knowledgeable mentors are not there, funds are not available, we are not knowing to that how to acquire the funds, how to do the research, we are not getting support from the administrative peer side, and due to that is lacking. But somehow we have to empower ourselves, and we have to do the such type of the research which we will be able to implement and convert into the evidence. Next please. These I said already we have discussed regarding the generation, the same problem we are facing in the clinical also. In the clinical, if I say from the superintendent, nursing superintendent to our novice staff nurses, they all are having the different generation. Okay, so due to different generation, we will be doing the work in our working place. There is chances of creating friction. Due to that, it leads to frustration. It leads to, we feel the harassment. Some recently one case I heard that, I'm not knowing whether it is true or what, ki one male nurse, he committed suicide due to harassment in the workplace. That news, just I heard that things is happened. Why these all the things is happening? Due to generation gap. Okay, so here also it's required that we have to sensitize to all the generation ki how they will be coping to each and everyone, how they will be making the workplace safe and favorable, and all the people they will feel to do the work. So that is there. Next please. Next. Now we will see what type of the challenges we are feeling or facing in the hospital setting. Disparity in the salary, everywhere it is there. If you will see in the government, or I will see in the private sectors also, urban and the rural areas, everywhere disparity is there. Our Supreme Court already given one passed the decision related to at least the nurses will get the minimum 20,000 salary. There are the many states they have not been followed. So that is the problem in the clinical area. Criteria of the promotion, ki these many years we will do, and after that they will be promoting to us. So there is no specific, that should be there. That should be there ki when you are giving appointment in the private institutions, also in the government, make clear that ki when we will be promoting, what are the criteria and in which base you will be giving promotion to us. Previous please. Lack of the performance-based incentives. Nurses are migrating, our good, competent nurses, because they are not getting what they want in the India. Due to that reason, they are migrating and going to the foreign. Caste-based reservation system, poor pay, workload increase, there is no recognition, occupation stress, unfavorable working environment, and these all are the situations are there. If you will see that, next. Why these all the situations are arising? These all the situations are arising because there is disharmony in the teamwork. Okay, we don't have the good teamwork. When we are providing care to the patient, individual as a nurse, it is not possible to provide care to the patient. Due to that reason, it's required the multi-dimensional approaches, collaborative approaches to provide care to the patient. We are working in the hospital as a team, so that teamwork is required. So next please. Lack of the nursing autonomy, everywhere is there. Unless we have the independency, unless we have the autonomy, we will be not participating in the decision making. It's not possible ki we have to empower ourselves. So to empower ourselves, we required these all things, and we required the accountability, autonomy. If we are the autonomy, definitely we will be accountable for our responsibilities. Next please. Next please. Shortage of the staffs, already we knew that these all are the conditions are there. Due to that, still the shortage of staffs are there. Workplace health hazards, already I have given the one example of what are the reason and what type of the problems we are facing in the workplace. So next please. These also I have discussed, interprofessional collaboration. Now the things is that these all the challenges we have addressed. Now we will see that how we will be managing these challenges. First of all, the main important things is maintaining the moral and the ethical standard. When we are doing work, we always should remember our code of well-groomed personality. That is required. Okay, in the hospital it's not like that. Sometime I have seen the nurses, their dress is not ironed. Okay, and they are going and they are doing the work. Just you see that in the planes, air hostesses are there. How nicely, how beautifully they looks. Okay, but somehow they are not dealing with the ill patient. They are dealing the person like us. Okay, but they are the well-groomed. So that is required. Our nurses also, they have to know that. They have to know that how to groom their self. कुछ गलत नहीं है. कोई बोले कि put the lipstick, wear the lipstick, do the makeup or all, nothing is bad. Do that. We should look beautiful. Okay? तो होना चाहिए अंदर से इस प्रकार का feelings आना चाहिए. It's nothing is कि like that कि we cannot do that. We are going in the hospital, we are going in these. Why we should do that? We have to groom ourselves. That is required. collaborating with the healthcare providers, participating in the policy making decision, being updated, good communication skill is required, partnering with the media, that is social media. Okay, nowadays we are seeing one small new matter came, it will be viral. Do the viral what we are doing, the good practices in our nursing. Okay, do the viral your evidence based practice, what you have done, new things, how in the new innovative way you are taking care to your patient, do viral. Okay, so that is required. We want to upgrade the status of ours in the society. For that it's required we have to make the good networking, as well as we have to whatever the positive image, positive stories are there, that we have to put on the social media. That is required. Next please. I think so already time is this continuing research we have to do. Career pathway already I said to you. Strong nurses networking, mentorship, preceptorship, nurturing novice nurses, reflect the 6C, that is very much important. So all the person should know about that, what are the things are there. That things I want to say that advanced nursing practice, what at present in our Gujarat only NPM is going on. Okay, NPM is going on, but still our NPM does not have fully autonomy. They have the partial autonomy, and even they are in the contractual basis. So this is the concern topic. We have to, it's not like that our regulatory bodies very nicely they are creating the syllabus, but they are not creating the post. So somewhere when we are creating the post, we have to create the post. Along with this, we give the scope. After doing of NPCC, there are the 3 and 4 colleges had the NPCC. After doing 3-4 batches came, afterwards these students they felt that कि ये करने के बाद मुझे करना क्या है? Nobody is ready to take them. Okay, nobody is giving this much as it is a residential course. So if you are doing something along with these, also required they have to concern with our ministry, they have to concern with our stakeholder, and they have to create the job, salary, their career pathway, what they do in the future. That is required. Next please. These also feel some initiation is required here. What is lacking? We should have the separate nursing directorate. There are the some state is having the separate nursing directorate, but our Gujarat we don't have the separate nursing directorate. It's required to do the implementation of Nursing Practice Act, so that it should be clear cut job description what we supposed to do that. Because sometime I also faced when we are in the hospital, we are doing the chest physiotherapy. When the physiotherapy came that, why you are doing the chest physiotherapy? It's my work. We are not doing something wrong with the patient, no. We are giving the chest physiotherapy only. But they are saying who has said you to do that? It's my work. So where is clear for us what we supposed to do? So for that is required कि Nursing Practice Act जो है होना चाहिए. Nursing Research Cell University और state level पे होना चाहिए just for the nursing. This is the big issue कि all the nursing institutions they should get the UGC scale. Okay, already Patidar sir morning he was discussing with me कि we will be doing something. So we will take this initiation in the government, and after that we will, because we are doing, the teachers are doing the work under the university. So we should get the UGC scale. Other discipline, they are getting the UGC skills. If I'll say BA, BCom, Science, Arts, their teachers are getting. Okay, so somewhere we are doing the less work. No, we are not doing the less work. We are doing the more work than them. Then also we are not getting the UGC scale. So this is a matter of concern. Required to empower our teachers. Not only we will wait for the Florence Nightingale. आज को देते थे अभी 15 कर दिया है. मुझे ऐसा लगता है drastic changes now, because everything is from the central level. We have the NET for the entrance. After completion of the BSc nursing, आपको फिर से NET देना, will be getting the registration. So these things we have the hope. Already 14 अगस्त को ये जो है करके गैजेट आ चुका है. We will see that within 1 year there will be tremendous changes in our nursing education. So that is the thing. This is just I put that you have to dream. You capture your dream, you work on your dream, explore, maker and organize as according to your dream. So don't stop to dream it. Dream what you want to do in future. Okay, so that is required. At last, with the beautiful quote here, your talent determines what you can do, your motivation determines how much you are willing to do, your attitude determines how well you do it. So thank you very much to everyone here for patiently listening to me. Thanks to the Jibin sir, organizing chairperson, organizing secretary, entire Shree Krishna Institute of Education for giving me this opportunity. Starting में सूरत से आने के लिए 2-3 बार 4 बार सोचना पड़ा. I said no, no, no. Then at last I said yes by seeing the NADA bet. So I got this opportunity कि I am here and thank you very much. आपने सबने मुझे I don't feel कि 1 घंटा मुझे टाइम कम मिला है पर इतने देर झेला, इसके लिए थैंक यू.
वेरी गुड नॉन टू ऑल. कैसे हैं आप सभी? थक गए? हम तो 2-3 बार खड़े हुए बैठे, इसलिए थोड़े फील कर रहे हैं. एक बार सभी खड़े हो जाओ अपनी चेयर से, रिलैक्स हो जाओ, स्ट्रेच करो अपने आप को. ओके, गुड. सिट. Please. Okay, herewith we have ending with first session, challenges in nursing education. Madam Indravati Rao, Principal, Government College of Earth, they have taken whole session nicely. They have covered all the points which are the challenges are there in nursing education. It is really day by day the challenges is increasing. In few years, so many changes it has come out. Now only, madam, they discuss our new commission. It is passed in parliament and it is signed on 14th of August. Means ये जो नया एरा आ रहा है अब, आई कैन से कि ये जो बोर्ड जो कमीशन आने वाला है, होप के नए साल में आपको नया कमीशन मिलने वाला है. जहाँ पे इंडियन नर्सिंग काउंसिल था उसकी जगह पे, जहाँ पे गुजरात नर्सिंग काउंसिल था उसकी जगह पे नया कमीशन आ रहा है. ठीक है. और साथ ही साथ अपनी नई हेल्थ साइंस यूनिवर्सिटी भी आ रही है. मीन्स विदिन ए ईयर गुजरात में तो बहुत कुछ चेंज होने वाला है, राइट. और चैलेंजेस गिने तो ये 55 to 6 years बहुत सारी कॉलेजेस अपने गुजरात में आई है. मैडम ने बोला कि पेशेंट तो कहीं दिखते ही नहीं, स्टूडेंट्स दिखते हैं हॉस्पिटल में. ये रियली बहुत बड़ी तकलीफ है. हमको एग्ज़ाम लेना पड़ता है, एक ही पेशेंट पे सभी स्टूडेंट्स. फर्स्ट डे भी वही पेशेंट, सेकंड डे भी स्टूडेंट्स चेंज होते हैं, पेशेंट वही रहता है. पेशेंट भी इरिटेट होता है, राइट ना. उसकी जगह पे नया ओस्की भी आ गया है, तो ये भी चेंजेस आने वाला है शॉर्ट पीरियड में. ठीक है. लेकिन ऐसा नहीं है कि ओनली स्किल ट्रेनिंग लेने से जो एक्चुअली पेशेंट केयर है वो कहीं दूर ना रह जाए, जो इमोशनली अटैचमेंट है पेशेंट और नर्सेज का, इट रियली रिक्वायर्ड। हाँ, बहुत बड़ी संख्या में नर्सेज बाहर आ रहे हैं और प्लेसमेंट भी मिल रहा है। प्लेसमेंट मिल रहा है लेकिन जो प्लेसमेंट मिलना चाहिए वो नहीं मिल रहा है। अभी मैडम ने जो पिक बताया था अपन को, नर्सेज लटक रहे हैं नीचे, डॉक्टर उसके ऊपर क्या कर रहे हैं, डंक मार रहे हैं, और दूसरे नीचे बहुत सारे लोग हैं जो खाने के लिए तैयार हैं। रियली नर्सिंग प्रोफेशन के साथ ऐसा ही हुआ है और हो भी रहा है, क्योंकि उसके अंदर क्या है कि अभी तक नर्सेज का जो प्रोफेशन है उसको दूसरे लोगों ने माना ही नहीं है कि ये भी एक अलग प्रोफेशन है ना, उसके अंदर सबको अपना अपना अलग वर्क करना चाहिए। सबको यूँ ही लगता है कि नहीं, नर्सिंग तो हमारे अंदर ही है, सभी पैरामेडिकल ही है। लेकिन नर्सिंग अपने आप में एक प्रोफेशन है। अभी गुजरात ऐसा स्टेट है जहाँ पे नर्स प्रैक्टिशनर फर्स्ट स्टार्ट हुआ है और प्लेसमेंट भी दे रहे हैं। होप के अब कमीशन आ जाएगा, सभी प्रैक्टिशनर जो कि अभी तक डॉक्टर नहीं आने देते थे, क्योंकि यदि प्रैक्टिशनर आ जाएंगे तो उनके प्रैक्टिशनर क्या करेंगे, लेकिन ऐसा नहीं है, दोनों का वर्क अलग अलग है। तो फ्यू इयर्स में बहुत सारे नर्स प्रैक्टिशनर अलग अलग स्पेशलिटी में भी आने वाले हैं और अपना स्कोप बहुत बड़ा है। लेकिन स्कोप के साथ साथ जब तक आप पढ़ेंगे नहीं, आप सीखेंगे नहीं, आप क्लिनिकल नहीं जाएंगे, एक्चुअल पेशेंट नहीं देखेंगे, तो ये पॉसिबल नहीं है। अच्छे प्रोफेशन के लिए बहुत कुछ करना पड़ता है, सीखना पड़ता है, पेशेंट के पास जाना पड़ता है, बुक पिक्चर देखनी पड़ती है, क्लिनिकल पिक्चर देखनी पड़ती है। खाली बुक्स या कॉलेज में थियरी पढ़ने से ये प्रोफेशन का उद्धार होने वाला नहीं है। इसलिए होप कि ये जो हम बोल रहे हैं वो आपको थोड़ा ध्यान आ रहा होगा कि नहीं, कुछ करें इसके लिए। बाकी नर्सेस तो बहुत सारे निकलने वाले हैं, लेकिन कंपटीशन भी उतना ही ज़्यादा है आगे में। यदि आप अच्छे नर्सेज नहीं हो, अच्छे नर्सेज मीन्स नॉलेज वाइज, प्रैक्टिस वाइज, रिसर्च वाइज, तो आपको कोई पूछने वाला नहीं है। और चैलेंजेस हर जगह हैं, चाहे वो थियोरिटिकल हो, प्रैक्टिकल हो। अभी मैडम ने बोला जैसे कि, और सर ने बोला था कि जो अच्छी कॉलेजेस हैं वही चलने वाली है। जो शॉपिंग सेंटर में या फिर कहीं पे दुकान में जो नर्सेज नई कॉलेजेस आ गई हैं वो अब नहीं चलने वाली। इसमें से आधों को नहीं मालूम होगा क्या इंडियन नर्सिंग काउंसिल क्या है। मालूम है व्हाट इज इंडियन नर्सिंग काउंसिल? आपकी कॉलेज इंडियन नर्सिंग काउंसिल की परमिशन है, आपको मालूम है? ये बहुत ज़रूरी है। बहुत सारी कॉलेजेस की इंडियन नर्सिंग काउंसिल की परमिशन नहीं है। अब अगले साल से तो कंपलसरी है कि वो कमीशन में आएंगे, कमीशन की परमिशन लेनी पड़ेगी। ठीक है ना? तो डे बाय डे डाइल्यूट होता जा रहा है। न्यू चैलेंजेस भी आ रही है, न्यू इनोवेशन भी आ रहा है, जैसे कमीशन आया, न्यू यूनिवर्सिटी आ रहा है। ठीक है, तो और आउट एग्ज़ाम भी होने वाले हैं। इसलिए होप के आप जब तक 4th ईयर से बाहर निकलो तो हो सकता है आपके लिए भी एक नया एग्ज़ाम हो जिसके लिए आपको रजिस्ट्रेशन के लिए देना पड़े, इसलिए उसके लिए सभी को तैयार रहने का है। ठीक है। श्री कृष्णा इंस्टीट्यूट ऑफ नर्सिंग भाबर ने बहुत ही अच्छा कॉन्फ्रेंस एक अलग जगह पे, एक्चुअली मुझे पूछा था कि सर हमको कॉन्फ्रेंस करना है, कहाँ पे करें। उन्होंने 2-3 जगह दिया, तो पालनपुर दिया, दूसरा पाटन दिया। मैंने बोला कि आप बॉर्डर पर हो तो क्यों नहीं बच्चे भी बॉर्डर देख लें, वहाँ पे अपने बॉर्डर वाले भाई हैं जो अपन रात को आराम से सोते हैं और वो अपनी सेवा करते हैं, इस देश की सेवा करते हैं, तो क्यों नहीं उनको भी अपन जाके मिले और अपने बच्चे भी देखे हो। सबको देखने का है ना, 0 पॉइंट पे जाने का है। हाँ, तो मैं सभी एक्सपर्ट से भी रिक्वेस्ट करूंगा कि थोड़ा अपना सेशन जल्दी जल्दी करें और बच्चों को वहाँ पे भी लेके जाने का है, क्योंकि वो भी एक बड़ी रिस्पॉन्सिबिलिटी है। वो देखेंगे तो उससे भी कुछ नया सीखेंगे। सो होप के यू विल एंजॉय दिस सेशंस, एंड जो आने वाले सेशन है उसमें भी सोना नहीं है। ठीक है, मैंने रिक्वेस्ट तो किया है सबको कि शॉर्ट में वो ले लें, तो जल्दी से करके फिर यू कैन सी द बॉर्डर एंड एज वेल एज द शाम की परेड होती है यहाँ पे, तो उसके लिए शाम तक तो रुकना पड़ेगा, उससे पहले निकल नहीं पाओगे। ठीक है ना? हाँ कि नहीं? हाँ, यहाँ पे आए हो तो सबको देख के जाने का है। ठीक है, इसलिए कोई भी जल्दीबाजी नहीं करे, सेशन पूरा करने के बाद ही करने का है, क्योंकि मेन मकसद है यहाँ पे आने का क्या है? नॉलेज, कुछ लेके जाने का है। इसलिए सो थैंक यू टू ऑल द टीम ऑफ जिबिन एंड all the staffs of Skin. Really they have wonderful workshop conferences they have arranged for us, and it is really good for, at least I can say, in North Gujarat. उन्होंने बोला मेरे को कॉन्फ्रेंस करने का, या करो करो करो, क्योंकि कुछ देखेंगे तभी कुछ सीखेंगे। लेकिन बहुत ही अच्छी तरह किया। अभी तक का बहुत सभी सेशन अच्छे थे। जो स्वागत किया वो रियली ऐसा स्वागत हमने कभी देखा नहीं है, ऑलरेडी सर ने बोला है। ठीक है, तो रियली इट इज़ गुड, एंड थैंक यू मैडम फॉर योर नाइस लेक्चर। थैंक यू एवरीवन।
Thank you so much, sir and ma'am. Please have your seat off the dais. This was a knowledgeable and meaningful session. We have learned about the main challenges we are facing today in nursing education. Innovation in nursing are new or improved ways of doing things and enhance the quality, safety, efficiency and effective of nursing practice and patient care. So let's move on the next session by our another eminent speaker. Now the next session is on topic nurses are real life superheroes transforming patient care. For the same, we are privileged to have our next speaker to take this opportunity to introduce Mr. Atul Sharma sir. Sir is working as assistant professor in Institute of Nursing Education and Research, AIMS, Batinda. Sir has completed his UG from Rajiv Gandhi University of Health Science, Bangalore. Sir has completed his PG from Father Muller College of Nursing, Bangalore. Sir is PhD scholar of National Consortium for PhD in Nursing by Indian Nursing Council in collaboration with RGHS, Bangalore. Sir has done post-graduation in psychology, subject specialty clinical. Sir has done post-graduation diploma in computer application. Sir is national IAP and BLS instructor. Sir has more than 10-year experience in nursing field. Sir is having lifetime membership in Nursing Research of Indian Trained Nurse Association of India, Indian Society of Psychiatric Nursing, Clinical Nursing Research Society. Sir has done many research on child psychiatric stress management, depression, substance use disorders. Sir has done more than 5 indexed publications and 4 non-indexed publications. Sir has organized various national and international conferences. Sir got Best Paper Presenter Award in national and international conferences. Sir got first prize in paper presentation and inter-college skit competition by UNESCO Chair Bioethics. Sir has attended as resource person, speaker, special guest or guest lecture in many national conferences and courses. Next, it is my honor to introduce our capable moderator for this session is Dr. Karpagavalli Nageshwaran ma'am. Ma'am is working as Dean, Faculty of Nursing and Principal of Kumud and Bhupesh Institute of Nursing, Ganpat University, Mehsana, Gujarat from November 2021 to till date. Ma'am is Gold Medalist in MSc Nursing 2021 from Bharati Vidyapit, Pune. Ma'am has awarded Excellence for Reviewing Journal of Evidence-Based Nursing. Ma'am has awarded for Reviewing Training and Award 2022 in Innovation Publication for Valuable Contribution in Peer Reviewing. Ma'am has awarded for Best Nursing Tutor in TNI Pune City Branch in 2015. She has published more than 15 research articles in national and international journals. Ma'am has attended and participated as resource person in many seminars, conferences and as well as international conferences. Ma'am has organized number of state level as well as national level conferences, workshops as well as webinars. Ma'am is editor board member and reviewer for various journals. Ma'am is examiner for undergraduate, postgraduate and PhD nursing student for various universities. So I would like to call our speaker Mr. Atul Sharma sir and our moderator Dr. Karpagavalli Nageshwaran ma'am for the session to the stage with a big round of applause and enthusiasm.
Okay, a very good afternoon everyone. How are you all? Enjoying the session? Okay, so I'll not Okay, so thanks for wonderful slide. Okay, because they wanted to show each people introduction slide as like memory of this institute what they are organized. So we cannot say ki stop and then coming to the next. So my topic is which is very simple topic. It is not like something is to be discussed and something is to be gain so much of knowledge and write and then you have to study. It is just a simple topic like nurses are our real heroes. Nurses are our real heroes. So do you agree with me that nurses are real heroes? Okay, so great. So you all know that nurses are real heroes. So that only you have chosen the profession because you also want to become one day hero and as well as heroine. Yes or no? We cannot say ki only hero. So with hero there will be heroine. So real life superheroes transforming patient care. Coming to the topic, transforming patient care. Transforming patient care, nurses are transforming patient care as per need. The patient care was needed in early days, maybe with the lady with the lamp was going and treating people and then coming back. They might be giving some medicine, they might be caring the wounded person, and maybe there was no such advancement. But as of now, there is a transformation is taking place. Each day, each time, we need to learn the things. And now you people are in the institute learning again after completing when you join for work, maybe in the college or maybe in the hospital. You need to learn. It is not that you completed BSc nursing, you completed master nursing, you completed PhD nursing, you are becoming learned. So it is not. You have to learn each day and with the profession and in the profession. Okay. So first slide was that was the ICN president. ICN president in 2023 International Nurses Day. They have said the theme which is being given, that is our nurses, our future. So nurses are the future. They said that our nurses are our future. So nurses are the future for world, not only for one country. So it is been the theme which was being set up by the ICN president. Second slide, that PM Narendra Modi during the COVID-19, PM Narendra Modi ji, they have says that nurses have done a very great work. Nurses have done a very great work and it is amendable. We cannot think that other people will be doing that. Anyway, in medical profession, doctors are there, pharmacists are there, but without these people or without those people, we are not able to combat the COVID-19. Yes or no? Okay, so next slide. Again, recently, President of India, Srimati Draupadi Murmu, conferred the National Florence Nightingale Award 2022 and 23 to the people in Rashtrapati Bhavan. So this is also who those people are, our heroes. They are our heroes. So that only they have got award from the President of India and the Rashtrapati Bhavan. Next, so what is nursing? What is nursing? So nursing is a healthcare profession that focuses on the care of individual and their families too. Individual and families to help them recover from illness and maintain optimal and quality life. They will recover and also to maintain a quality life. I'll complete within, I'll not take so much time, I'll complete within 20 minutes. Don't worry. Okay, happy? Because I know you all want to go to border and you all want to enjoy this place, not only to listen me or sir or other. Agree? So, but for 20-25 minutes, 20 minutes you need to cooperate. Okay? So these are the nurses. And nurses have historically been a huge symbol of healthcare. Nurses have been a symbol of healthcare. They are not just giving the care, giving the medication, giving the IV fluids, flushing the drops and then again coming back. So they are the huge symbol of healthcare because they need the skills, they need the attitude, they need to talk to the people, they need to communicate to the people. It is not just a working with machine, working with laptop. It is we are working with people, we are working with human being, and it is the only profession who is working with the human being, and 424 into 7 hours. It is not like for 1 hour, 2 hour, 3 hours. Okay, so this applies whatever the nurses are doing, this applies the knowledge what they are learning, and nurses also are leading the charge to help shape the policies. When we talk about, just now sir was talking, madam was talking about the NNMC, National Nurse Midwifery Council, just now recently has been passed. So they are the leaders, they are the policy makers, they are being involved in molding the policies. Policies is being molded and policies is being developed, and we are also becoming in that part, and we are also taking in that part that we are shaping the policies, we are preparing the policies, we are making the leaders, we are doing the heart. So there is no denying that the nurses are becoming more and more influential. So nowadays, it is not in the 90s or 80s and 70s when British was there, when England people used to go and 1 or 2 people and they used to come back to India. Then they used to just gain the 3-month, 4-month training in nursing, and then we need to be like learning what they have learned from the England, what they have learned. So it is now they are becoming more and more influential when it comes to the medical industry, and we can say that they will be the key driving force for the future transformation. Who? The nurses. Nurses will be the key driving force. They will drive the people. They will lead the people. They will take the people. They will be heroes. They will be heroes in India as well as in other countries. So next, what was there in the future and what was in the present and what will be there in the future. So what present and past and the future. So what was there in the past? We know that lady with the lamp was there, and then some people used to go to the maybe in the training course maybe for 2 months, 3 months, and later on in next evolution of education, the women started receiving the training. Before that only Florence Nightingale, and with that some few women were there. And then they thought that only ladies can go with that profession. In 1960s, specialized nursing began to emerge, and nurses could be trained for some intensive care. Nurses could be trained for intensive care. At present, what we know? At present, just now we are talking digitalization is taking place. We need to learn. So nursing education and technology represent the largest difference between the nursing past and the present. So nowadays we need to know that a college degree program, a diploma program, a registered program is needed to walk into the hospital. Before that, only just like we can say that only few people like those who interested, they can go just for the some 2 months, 3 months, 5 months training, and they can be walking into the hospital. But right now there is a graduate. When we talk about the any recruitment, there is highlight what is the qualification needed to be coming and applying for this post. Yes or no? Many people want to apply for post in some NORSAT, maybe they want to apply into some other, but for what is the qualification? So qualification. So technology has advanced, and again technology has taken place. So nurses in the future, what we expect in the future? Nurses in the future, more education, more technology. We can say that total 57% of the nurses hold at least a bachelor degree at present, and then again 18% nurses have completed a graduate program. So we need to see that there will be advancement in future in hospital side as well as in the degree and education wise. So nurses need to understand how to gather and analyze the new data. So the importance of nursing, importance of nursing, that is transformation nursing practice, and how to improve that, and how the people need to care. So the evaluation high technology hospital is been taking place. We know that in India, in different states, so high technology institute is been taking place. We need to go through it. We need to learn what are the different methods they are using, what are the different modules they are using, and to combine the office and hospital practice, length of hospital stay that are among the shortest in the world. So these are some of the importance of transformation nursing practice, which is to improve the care. So to improve the patient care, and again to improve the patient safety, and improved again access to care. People used to go to the hospital. Before the early days, they don't used to go to even sub-center. They used to take treatment at home, take all deliveries at home. They don't want to go to hospital for any checkup. They just, if there is some any other Babaji or somebody sitting, they will go there and they will take the treatment. But nowadays, access to care is improved because so many programs has been come up and so much of information is being aware, or the awareness has been taken place and the people are aware. Respite and palliative care is also included. Care coordination for chronically ill and elderly people. Greater access to specialty care and focused care is also transformed in the nursing education and the practice. So why nurses are integral to the future of the healthcare industry? Why? So we need to think about that. So on field insight into the industry. So nurses are there to have an insight, into the industries. They are working in the clinic, they are working into the hospital, they are the bridge between the people. Okay, it is not only that they are just working with one side. They sometimes need to listen to doctor, they sometimes need to listen to patient, they sometimes need to listen to families. So they are the bridges, between two people. So next, what is that? Greater degree of interaction with the patient. Greater degree of interaction with patient is what? They are interacting with patient and even with the family members and even with the doctors, healthcare workers. They are working with multidisciplinary team. One is the nurse coordinator who is working with patient, and as well as she is working with doctors, she is working with psychologists, she is also working with nutritionists. She is coordinating and providing care to the people. And shaping the future of nursing in a digital world. Nurses is the profession, and they are transforming and they are shaping it into the digital era. So this is the generation, that's now we said in the previous slide, this is the generation who is being very smart with the smartphones. Before this generation, when smartphone was not there, we used to, when we used to study in in 2005 and all, we don't used to have mobile phone sometime. And we used to go and take to the STD call, and then in STD call 1 minute, if you want to talk, there is 10-20 rupees bill used to come. So we used to talk very less. What is required? Rest or no? And we don't have, that time we did not had any Google. It was there, but we were not accessed. That time there was no 2G, 3G. Now 4G, 5G also is there. Okay. So keen understanding of both the caregivers and the care receiver point of view. We need to understand. So this is also why the transforming is taking place. So the nurses are bridging the gap between the patient and the doctors, and nurses are perfectly placed to help shape the future medical industry with valuable perception. They should have a good perception to work towards. Next please. A growing vocation, of course. So that only you all are here. It is a growing vocation. People used to get the job. If you don't have the job, you will not come to the profession. So it is a growing vocation. And this growing vocation will not stop. Because patient will not stop, hospital will not stop. Again and again so many pandemics are coming and patients are increasing. Hospital stay is increasing. So nurses also should be increasing. Yes or no? And just now government has, like you can see in recent year, after 2014, and we can see that 6 new AIMS was there. 6 new AIMS with AIMS Delhi. That is all Rishikesh, Patna, Jodhpur, Bhopal, and Raipur, and again Bhubaneswar. So with that 6 AIMS, it was being leading and patient was being treated. Again with that, again 18 new AIMS has come. Yes or no? So why these AIMS are coming? To improve the quality of patient care. Yes or no? Motto of central government is like to get access of healthcare to all the people in all the state. It is not just like we don't have state hospital in particular states. We have the state hospitals. We have Gandhinagar Hospital, Ahmedabad, very big hospital, and which is more than what is AIMS Rajkot is giving, more than like bigger in strength. But again the quality of care, again the highest tertiary care which is to be provided by AIMS, and again fulfilling the aims and criteria of that state, they are providing another services. So same way, so it is also. So what are the 5 ways the nurses are transforming? Nurses are stepping into the new leadership roles. Agree with me? Nurses are becoming leader. Yes? Where and all you can see the nurses are becoming leader. Nurses are becoming leader. Where and all? In administration, nurses are there. Okay, like take my example. If I am there in the AIMS, okay, so if director is giving me another post, like you have to work as a nursing superintendent. So I am becoming nursing superintendent. Okay, I am the in charge of nursing service in AIMS. I will be. Yes or no? I have also got for some time. Then again, it has been handed over because of lot of work. So it has been. So same wise, another field, that is one is a service, and one is college, and one is your administration, and then research. You have the leadership, you have the leadership roles in many eras. It is not only in one place, and you need to show the quality of work what you can do in that leader on you, and they tell you do this, do that. Our people should become a leader. Nurses are creating a culture of health. Next, culture of health. We are preparing people, and we are having a culture of health. We are treating people, we are having human culture. So we also should transform, we also should work with a culture perspective. We should keep in our mind when we work. So nurses are pursuing the more advanced degree. Of course, this is also transforming. Before olden days, GNM था, ANM था, ठीक है? ANM भी नहीं था तो LHV था. LHV भी नहीं था तो कुछ और जो है 6 मंथ का दाइज और जो दयाज जो होते हैं वो कोर्स करके और वो ट्रेंड कि हम नर्स हैं. ओके, नाउ पीपल इफ दे आर जस्ट ग्रेजुएट, they want to think what we can learn it from by doing the post graduation, how we can grasp the thing, how we can like learn the things to become a post graduate. Then in the post graduation they will have separate specialities, sub specialities. From that sub specialities they can choose some MPhil and PhD. And now again in future and at present, again in India also, if you in abroad it is already started and we are going to abroad to learn. Postdoctoral also will be coming. After postdoctoral, again we will have some other tentative plan to do something to learn something. Okay, so nurses are the forefront of the patient advocate. Of course, if something is happened, first of all, doctors will not be available every time. एवरी टाइम डॉक्टर्स नहीं रहेंगे पेशेंट के पास, आएंगे, राउंड लेंगे, दवाई लिखेंगे, मेडिसिन लिखेंगे, प्रिस्क्राइब करेंगे, कुछ और कुछ होगा, डॉक्टर से बात कर ली, भूल गए, छोड़ गए, चले गए. देन वी विल बी देयर टू लुक आफ्टर. एंड if something is happened, who is asking? Patient people or family members or relatives, they will be asking कि डॉक्टर ने क्या कहा, हमें समझ नहीं आया, डॉक्टर ने क्या कहा, हम कब डिस्चार्ज कर लेंगे, हम कब हो जाएंगे फ्री, हमें ये प्रॉब्लम्स इतनी ज़्यादा तो नहीं है कि हमें और कहीं दूसरी जगह दिखाना पड़ेगा, हमें कुछ और मेजर ऑपरेशन की ज़रूरत तो नहीं पड़ेगी. किससे पूछते हैं ये सब क्वेश्चन? टू whom they will ask? They are asking to nurses, and nurses should answer in a advocate way. It is not that nurses are becoming very super कि they will अरे सब ठीक हो जाएगा, कल चले जाओगे, जबकि होना ही नहीं है, होगा ही नहीं, हमें पता है. Should say and should not give false reassurance and should be giving a clear cut idea about what is to be happen and how it is your progress will be done, and also like what and all you have the ways to like have a treatment. Okay, next please. So nurses are community leaders and change makers. What is community leaders? I have completed 15 minutes. Okay, so nurses are the community leaders and change maker. Nurses are community leaders. They are leading in communities. When we talk about community, there will be CHC, there will be PHC. There the nurses are working. In Anganwadi also, people used to go and give the awareness campaign and the programs. So in community also, they are talking to the leaders, they are talking to the panchayat people, they are talking to the taluk people, they are talking to the leaders, and they are becoming a awareness, like we can say some type of leadership skills they are showing in their CSC, PSC to make people aware and to lead the panchayat people and the taluk people, tehsil people to have access to quality of care. So again, some few slide about how the transformation is taking place and has taken place. So in a significant move towards strengthening nursing workforce in the country, the cabinet, our cabinet, India cabinet, Committee on Economic Affairs, which is chaired by Prime Minister Shri Narendra Modi ji, has approved establishment of 157 new nursing college in co-location with existing medical college which is there in each state. So 157 government college is going to come. This is what in foreign countries, in everywhere they are talking about invest in nursing, invest in nursing, invest in nursing. So Modi ji has invested 157 government colleges. So when 157 government colleges comes, again the scope of nursing improves, because we will have graduates, we will have the faculty, we will have the infrastructure, we will have the people. So again 157, it is not less number. In India 157 nursing colleges is going to come. So our again superheroes are going to come in government colleges. They will be taking education, and you will also have opportunity to work in those 157 government colleges. Next. So one again, this is also very important. Have you heard about NRSC? How many people have heard about NRSC? Just raise your hand. Short form बोला है मैंने, NRSC. So training of trainers on simulation based education. That is being started in India, and NRSC, National Reference Simulation Center, which was established in October 2018 by a TETRA project. So it was a TETRA project, and this tetrapartite collaboration between four, that is between Indian Nursing Council, between JPIGO, Lardal and SGT University, which is there in Gurgaon, Haryana. These four people have started this, and they have made one simulation lab which is been there in the SGT University. Okay, so which hello, okay, fine, thank you. So which is been there in the SGT University. So this simulation, National Reference to Simulation Center, जब आप गूगल पे सर्च करेंगे, बहुत सारी चीज़ें सर्च करते हैं, एक बार ये भी सर्च करना. So National Reference Simulation Center, which is there, so it has given a role model. जो ये चार लोगों ने मिलके बनाया है, इंडियन नर्सिंग काउंसिल, JPIGO एंड लार्डल एंड SGT, और SGT के अंदर ही इस्टेब्लिश किया है. वो एनीवे बहुत बड़ी सिमुलेशन लैब है, विच विल कॉस्ट मोर देन 10 करोड़. ओके, वन लैब हमारी इस्टेब्लिश हुई है. मैं वहाँ गया हूँ, मैंने ट्रेनिंग भी ली है. तो वो एक एग्ज़ाम्पल है हमारे इंडिया में कि हम कॉम्पिटेंसी एजुकेशन देते हैं, तो उसको कैसे हम बच्चों को सिखाएं, हाउ वी नीड टू टीच. जब हम बात कर रहे हैं न्यू करिकुलम की, नेक्स्ट स्लाइड जब आएगी, तो ये भी बहुत अच्छा एक एग्ज़ाम्पल दिया है हमारी इंडियन नर्सिंग काउंसिल ने. इंडियन नर्सिंग काउंसिल की वजह से ही जो तीनों लोग हैं साथ में आए हैं, दैट इज़ JPIGO, लार्डल एंड SGT. सो ऑल पीपल वेन एवर गेट अपॉर्चुनिटी, कोई ट्रेनिंग आती है तो वहाँ जाओ और सीखो वहाँ पे, और यू विल लर्न. 4 years का जो हमारा सिमुलेशन है, दैट इज़ यू विल लर्न इट विद इन 5 days 10 days, बट विथ फर्स्ट यू नीड टू लर्न द बेसिक, नॉट नाउ, फर्स्ट यू कंप्लीट योर ग्रेजुएशन. सो पेशेंट सेंटर्ड के सो कोर कम्पिटेंसी, ये जो 10 और 9 एक कोर कम्पिटेंसीज़ हैं, ये हमारी न्यू करिकुलम में अडाप्ट हुई है, बिकॉज वी नीड टू हैव ए कम्पिटेंसी बेस्ड एजुकेशन. पहले क्या होता था, थ्योरी पढ़ लिया, हॉस्पिटल में कुछ प्रोसीजर सीख लिया और चले गए, सीधे आके लर्न कर लिया. बट अभी जो न्यू करिकुलम बनाया है वो कोर कम्पिटेंसीज़ के साथ बनाया है. दे हैव क्रिएटेड कोर कम्पिटेंसी इन दैट, दे हैव इंक्लूडेड इन दैट. सो दीज 10 कम्पिटेंसी ये हमें लर्न करनी है लैब में, और जब हम ये कोर कम्पिटेंसीज लर्न कर लेंगे, देन इट इज़ ईजी फॉर अस टू टेस्ट इट ऑन ह्यूमन बीइंग. If we don't do this in the lab, directly we are testing on human being, they will feel pain, they will be having like heart attack. Yes, so we need to adapt that, and this is also for needed for our superheroes. Next please. Again one more, another transformation, very nice example. Manipal Academy of Higher Education. Have you heard about Manipal Academy? Manipal Academy, Mahe जिसे हम short form में बोलते हैं, it is situated in Udupi in Karnataka. It is a very good private university, one of the good private university in India. So this Manipal Academy of Higher Education and University of British Columbia, that is UBC, they have signed one partnership recently, and they are giving now, they have taken admission also. I have just recently got this information. So they have signed, and they have started the dual degree program. Student, those who are registering in that Mahe, they will also be affiliated to UBC, and they will have 2 degrees. They can go to Canada and they can work there. So this is also one of the innovation. Next please. So mentoring nurses for a healthcare future 2014, Government of Uttar Pradesh, they just have started. Government of Uttar Pradesh, जैसे दयालाल सर ने भी बोला और पहले भी बात की थी हमने, तो थोड़ा इनिशिएटिव लिया है गवर्नमेंट ऑफ उत्तर प्रदेश ने भी, बिकॉज अंडर द लीडरशिप ऑफ श्री योगी जी. So they have launched 25 high priority district for nurse mentorship program. And this nurse mentorship program, they have tested it and they found that it is very success. And then again, they have, after that, they have scaled up into the 820 blocks and 79 district hospital. So it is also running now. So it is also a very good transformation step for our nursing superheroes. So nurse practitioner in critical care program is also started. We all know NPCC, and it is also after the basic education you can choose it and you can have it. Next please. So Government of India launched Ayushman Bharat scheme. Ayushman Bharat scheme in 2018 and recommended by the National Health Policy. Okay. So in Ayushman Bharat scheme, 2 parts are there. One is Pradhan Mantri Jan Arogya Yojana and creation of 1,50,000 health and wellness center. This 1,50,000 health and wellness center created CHO post in all over India. So this is also one of the transformation, and so that only CHO. It has been full sound. We are able to hear it after 2018. And later on, there will be some permanent jobs also in CHO will be created. Okay. Next please. Why evidence-based practice? Evidence-based practice is needed to transform the nursing. We need to learn it. We need to review it. We need to put it into practice. We need to test it. And then we need to rectify what is change is being needed and what new we need to create and what else we need to do if it is not done. So this is the evidence-based practice. We are testing it and then we are doing it, again testing it, we are doing it, which is good one, we are taking it in our practice and again we are following those things. That is the evidence-based practice. Okay, I will not tell in the detail. So whatever, if you are going to give oxygen to the patient, it is being tested by which method you need to give. It is, you are going to give cannulation, it is also to be tested. It is also to be practiced. It is also to be rectified. Okay, so this is what, and using the correct intravenous catheter size. Next please. So this is another, my second last slide. Okay, just 2 minute और लूँगा मैं आपका. ठीक है, सब लोग खुश हैं? वेरी गुड. तो 2 मिनट शांति से सुनते हैं. सो शांति से सुनते हैं, है ना, अशांति से नहीं, शांति से. So Tamil Nadu is a state in that this news has come. So India nurse who delivered more than 10,000 babies. So what nurse and midwives are vital for India's healthcare system, but it faces challenges due to high demand and limited resources. We know that. And this Kathija Bibi, the name of this retired nurse, the photo is being kept. She is retired. Okay. So a recently retired nurse who have received a government award for overseeing more than 10,000 successful deliveries. Successful deliveries. In her 33 years of service in government field, she has done 10,000 successful deliveries by her hand. And out of 10,000 deliveries, one also did not get serious. This is again happiness. One also did not get any problem that the child has to go to hospital or for higher center or the child need. So इतना skill हमें सीखना है. ये सब skill का है खेल, केवल पढ़ने का नहीं है. We need to learn and simulation and the practice and the hospital. It is not only the book. हम पढ़ के थोड़ा सा कोचिंग जाके नोट सेट लग के वहाँ जाके कुछ नहीं आता है, उससे नहीं काम चलेगा. We need to learn. Okay, next. I gave the example. Again next. Next. So this is another example. WHO also has put in the website. WHO की वेबसाइट में भी आप जाके देख लेना. So ये जानते हो ये कौन है हमारे हेल्थ मिनिस्टर, क्या नाम है इनका? हर्षवर्धन जी है? ओके, शायद पता नहीं है आपको. सो एजो जॉस इज़ ए नर्सिंग ऑफिसर इन द इमरजेंसी डिपार्टमेंट ऑफ डॉक्टर आरामल हॉस्पिटल. डॉक्टर आरामल गवर्नमेंट हॉस्पिटल है दिल्ली के अंदर, ठीक है. ही हैज़ बीन ए पार्ट ऑफ सिवरल ह्यूमैनिटेरियन एंड हेल्थ मिशन इन द पास्ट, इंक्लूडिंग बहुत सारे, इंक्लूडिंग नेपाल अर्थक्वेक इन 2015 and Kerala flood in 2018. And this Ejo Jose said, I got a call from the health minister or the ministry, and they informed that I was chosen to be a part of medical team to be sent to coronavirus hit city of Wuhan in China to evacuate our Indian citizens. So he got choice कि मैं जाऊँ, मेरी मर्जी है, नहीं जाऊँ, but he chosen to be to go and evacuate. It was not like under pressure कि आपको जाना ही पड़ेगा. It is his choice, so that the people becomes hero. Okay, so we need to clap for those people. Okay, so last slide, conclusion. Nurses are innovators, nurses are leaders, nurses are scientists and fires patient advocates, improving healthcare and patient outcome across communities in a wide variety of setting every day. Okay, with that I would like to thanks Skin College of Nursing, faculty, principal, organizers and all my dear delegates from different part of state and different part of district of Gujarat. I hope we have interacted for very short time because inauguration time took so much time. Okay, so anyway, nice meeting you all and nice hosting. Thank you so much. Thank you.
It was a good session. Mr. Abul, transforming nurses are real heroes, especially transforming the patient care. As a nurses, how do you want to see yourself later? आगे जाके कैसे देखना चाहिए आपको? How do you want to see yourself? How that is called transformation. How I want to see myself, how I want to see my profession. Am I want to see as a nurse? Am I want to see as a teacher? Am I want to see as a scientist? Okay, how we want to see ourselves. Okay, nursing is a best profession that we will deal with the patient, human life from home to term. That means we are caring of the antenatal mother, we are caring of the fetus, we are taking care of baby till death of the patients. Now the opportunities and scope has widened, government has made a policy and our opportunities also too wide. More than 41%, as per previously the speaker has mentioned it, around the 41% of the healthcare sectors, nurses are playing an important role. Before it has been bedside, nurse educators, nurse administrators, now we are moving on to nurse researchers and nurse practitioners. So, budding nurses of you, okay, have a greater opportunity, but prepare in a form that knowledge, skill and attitude. Best luck for every one of you. Thanks for an Shree Krishna Institute of Nursing Management, principal and organized team for inviting me and given an opportunity. Thanks to everyone.
Thank you so much, sir and ma'am, for the wonderful session. Now, it's time for our next session on topic fostering innovative practice and technological advancement in nursing education. Evolving landscape of healthcare, nursing education stand as a cornerstone, shaping the next generation of compassionate caregivers and critical thinkers. Speaker for the session is Dr. Shweta Joshi, ma'am, Professor and HOD of Child Health Nursing at Dr. D.Y. Patil College of Nursing, Pune. Other than doctorate in nursing, ma'am has completed diploma in computer basics, diploma in naturopathy, diploma in basic holistic health and food reflexology. Ma'am have done trained infant and young child counseling course. She has presented many papers in workshops, seminar and national conference and international conferences. She has published more than 20 research articles in national and international conferences. She had published more than has attended and participated as resource person in many seminars, workshops and conferences. She is course coordinator of Pediatric and Neonatal Nursing Certificate Course PIMS. She is member of Training of Trainers TOT program under SIDA. She is examiner, paper setter, moderator cum chairman for Pravara Rural University Loni, Datta Meghe Institute of Medical Science University Nagpur, Dr. D.Y. Patil University Pune, MGM University Mumbai, RGU HS University Rajasthan and Gujarat University. She is guide for PhD, postgraduate and undergraduate students of Dr. D.Y. Patil University Pune. She is trainer for neonatal CPR under Indian Academy of Pediatric and SOMI. She is infant and young child counselor under BPNI and IAP. She is trained for BLS and ACLS. She was INC and HOC inspector in 2012. She is NEC coordinator, ISO DY, MR, NIRF, data coordinator of Dr. D.Y. Patil College of Nursing, Pune. She has reviewed book of Target High, staff nurse recruitment exam. She has lifetime membership of TNI, SOMI, Indian Association of Neonatal Nursing, Nursing Research Society of India, Forensic Nursing Association. Ma'am got Best Pediatric Award in 2006. She also got Best Nurse Researcher Award in 2017. Moderator for this session is Dr. Vijay Kumar Gautam sir. Sir is working as a principal of IKDRC College of Nursing, Ahmedabad. Sir is expert member of Board of Studies of School of Nursing at Sanskriti University, Mathura. He is inspector to inspect the school and colleges of GNM, BSc, PBBSc and MSc Nursing program under Gujarat Nursing Council and Indian Nursing Council. Sir has published more than 15 books including nursing informatics, community health nursing, procedure manuals, nursing management, etc. Sir has published more than 30 research articles in national and international journals. Sir has attended and participated as resource person, chairperson, key speaker in conference as well as webinar. Sir has organized number of state and national level conferences, webinars and workshops. Sir has presented more than 10 paper and poster presentation in national and international conference. Sir has done certificate course in human relation in healthcare, critical care nursing, fundamental of improvement, as well as certificate course in cardiovascular life support, that is SCLS, for health providers. Sir has also done diploma in naturopathy and yogic science. Today I am honored to welcome Dr. Shweta Joshi ma'am and Dr. Vijay Kumar Gautam sir to the stage. They are renowned for their expertise in nursing, and their contribution have been instrumental in shaping the way we perceive and engage with fostering innovating practices and technological advancement in nursing education. Ladies and gentlemen, please give a big round of applause to Dr. Shweta Joshi ma'am and Dr. Vijay Kumar Gautam sir. Over to you, ma'am.
Okay, thank you, Nikhila, for that wonderful introduction. Very good afternoon. I know some of you want to be, going for lunch. Some of you have finished lunch. So there is a group of people who are still hungry, including me, and those who already had a food and want to sleep. So I feel audience are, you are ready to listen me? Okay. Okay, so a very warm good afternoon and a greeting from DPU Pune. So how many of you thought today that you will be learning something new in this conference? You came with the thought that you are going to learn something new in this conference. Only 1-2 hands I can see. Okay, others have come to see the border, I think. Okay, so what is my topic given by organizing committee is fostering innovative practices and technological advancement in nursing. Now, what is innovation? What is innovation? What comes to your mind when you think of word innovation? Yes? To enrich? Yes, very good. To find out something new. So, having some new ideas. Okay, so basically what innovation is? It is a practical implementation of ideas. Okay, so it can be just identifying something new or which is already been existing, you are just improving that. So basically you are finding out a new solution for old problem. Next. So before going to that, we should know what is the history. We all know we have a very good history when it comes to education as well. We had a Gurukul system, everybody is aware of it. So it was very much of, given a student-centric, you can say, all child was been given their choice what they want to be learning. It was more of holistic development. We had an international university at Nalanda, Taxila. So all that we have very enriched or a rich history of education and even a rich history of innovation. There are many innovations which are conducted or which are done by Indians. One of the famous is zero. Who is invented zero? Aryabhat. There are many others. Or Sushruta Samhita who has involved, who has find out the technology how to do plastic surgery, cataract surgery. There are many medical instruments which have been derived by them. So basically, we are not been, always wanted to find out something new, find out some new solution. But something happened in between, we are actually lagged behind. There was some slow process. Why? After that innovation, if you see the history, there was some slowing of the process, and that was because of British era. You all know that British has ruled us, and one of the bad advantage of that is we have been, pulled back. So if you know, before when they came to India, they first came for trading, and what are the basic problem they had, which is common with the couples? Communication. So communication was the basic difficulty they had. They were not able to communicate. We have enriched variety of languages. So they had sent a person called Macaulay. And Macaulay has been sent, and he was told to do a survey and identify what are the weaknesses and what are the strong points in this culture. And you're supposed to see that what he has highlighted, this is already there in Google, you can see later on also. But he said you should replace the old and ancient education system. Okay, we have a very good and enriched system of education. If you are able to break that, You make them understand what you are learning is not important. What is important is speaking fluently English, following Western culture. So this has been still date we are inculcated with that. Basically what they wanted people who can communicate good English and who will be working as clerical faculty. Okay, they will not use their mind, just follow the instruction which are given by Britishers. So this has held us back of creating new thing, inventing new things. Okay. So this is just an hypothetical situation. This drawing is of Stone Age. Okay, if you have seen, if some of you are interested in history, that previously people used to draw on the caves. So this is just a hypothetical, so you can say situation where two mothers are sitting and they are talking with each other. What is the favorite topic of them is talking about the kids. So one mother is telling, oh, what your kid is doing? She said, my kid, he is a hunter. He hunts, rabbit and deer, and next month onwards he's been promoted and he'll be hunting elephant. So he says, the proud mother asked another mother, like, what does your son do? She says, my son, oh, he's such a useless. He sits in the cave and draw all over the walls. Not knowing that this is going to be a definite movement for civilization. So that creativity has always been neglected or suppressed. Now nextly, you all know Maslow's hierarchy. So it starts with your basic needs, physiological needs, safety, your affection, and then self-realization and self-actualization. But today we have one more basic need, that is Wi-Fi. Is it there? Everybody is having Wi-Fi in your net? Okay. So next. As already the previous speaker also told you that we are digital natives. I mean, you all are digital natives, we are digital immigrants. We are still trying to learn and understand what this technology can really do. And you all already are sitting who all are experts in digital world, isn't it? So technology, we cannot run away from it. It is going to definitely foster our innovative teaching methodology. That's why we have to learn about technology. So technology is nothing but methods, systems, or the devices which are helping us to learn new knowledge and skill. Next. So what is the need? Why should we have new innovations and teaching technology, technical methods in teaching? Is there a need? Yes, okay. Now why there is a need is, so first to identify the gaps. Where are the gaps? Like in theory and practical, you already saw previous slide that where is the gap, how much you are learning and how far you are utilizing that knowledge in your clinicals. Second, next, to discover the trends. Next slide, please. The next, to uncover the abstraction. Next, can you please keep on playing that? And to synthesize the solution. So identifying the gaps, identifying the trends and the abstractions which are uncovered, and definitely this is to get the solution. Remember what I told you is innovation is actually identifying a solution for, a new solution for the old problem. So along with technology we are able to identify the solutions. The next. So everybody have learned Bloom's taxonomy? No? Okay. So Bloom's taxonomy is basically a classification of the objectives where what you want to have at the end of your class or after your session from the students. So there are levels of classifications are given by them. So where the first step is remembrance. That is what actually happens. We remember, we memorize, we mug up, and then we vomit on the exam paper. And after next year, the previous thing is washed off. So that's supposed to be a very basic level. What is important is learning, understanding, applying, synthesizing, and creating a new thing. So everybody is familiar with this man? How many of you have seen Three Idiots? Most of you. So who is he? Chatur. Okay. So Chatur, he has given a fabulous speech without understanding a single word what he spoke. You know? So we don't want any Chaturs in our class, neither in nursing profession. So please understand, remembering and memorizing is useless until you understand the thing. So the traditional method of learning where students are, you know, what they need to know, and then the student has to memorize the information, and there will be activities or assignments which will be given by the teacher. Next. So we are shifting from the previous way of learning, that was teacher center, to student center. So it is student center, the teaching. Is it student center, or you have to follow the instruction of your teacher? Follow the instruction. Okay, it is both way. I am not saying student center means there will be no teacher, but we are giving importance to what you like rather not what I like. Okay, so that is what is student center. So you will be also happy. And why this has to be done? Because the students' learning styles are different. You know, each student has a different way of learning the, you know, particular thing. So some are good in visuals, some likes to see and they remember, some are good with auditory, some are good with the skills, some are good with writing. Unless they write, they don't remember. Okay, so we have to think of all these different skills what the student has. Next. Okay, next, this won't be working. Next. So we'll be seeing few teaching methodology, okay, which are been, you can take it as innovative rather than a simple lecturing method. Okay, so first is a very common or very old method is program instruction. By the word itself you can understand it is a program which is designed on some instructions. Now this is not very new, this was been invented around 1950s by B.F. Skinner, and what does it say is that it is a method of presenting new subject matter with different gradings. Okay, so there will be classification of subject or subcategorization, and there will be evaluation which will be taught to the student. Okay, there are two types of program instruction. One is linear program instruction. It is also called as horizontal program. You know, so after one level, second level and third level. So it goes in a row. Whereas branching, there will be 2-3 levels will be taught, and in between there will be test taken. If student is able to give that test, he goes for the next level. If he is not able to, he has to again come back from 1. Okay, so this is how it works. Can you click on previous slide? On examples. The next slide, types of program instruction. In that example, can you click on that example? You cannot click, it's a video. You have to say just okay. Just say okay. Or you can just say okay.
Here's a very simplified model of a tutorial with one teacher and one student. The teacher takes a chunk of subject matter, whether it be math or history or physics or whatever, breaks it up into small, easily digestible items of information, arranges these items in a logical sequence, and then feeds the first one into the mind of his pupil. Before proceeding to item number 2, he asks the student a searching question to test whether or not he has grasped item number 1. If he answers correctly, the teacher feeds him the second item, asks another searching question, and so on. But if the student answers incorrectly, the teacher feeds him the first item again, perhaps presenting it from another angle this time, or breaking it down into even tinier units. Then he will go on doing this until he is quite certain that his pupil has understood item number 1, and it is safe to proceed to the next unit of information. This is all very fine, but of course in a mass education system, we can't afford the luxury of one teacher per student. The nearest we can get to this is to have one textbook per student. And back in the 1950s, this gave the educational psychologists an idea. They decided to take a textbook and break it up into small, easily digestible items of information, arrange these items in a logical sequence, present the first item to the student, and then ask him a multi-choice question to test his understanding before presenting him with the next item, or branching him to some appropriate remedial sequence. Programmed instruction was born, a first attempt at an automated tutorial. But the program textbook was awkward to use and involved a lot of page turning. So in the 1960s, the teaching machine was invented to turn the pages mechanically, so to speak. But these machines were pretty cumbersome. So in the 1970s, when the computer became cheap enough to be used in schools, it took over the role of the teaching machine and turned the pages electronically, in a sense. And that is how programmed instruction graduated from the programmed text to the teaching machine to the computer.
Okay, you understood the video? It was just a short explanation that how program instruction works.
Here's a very simplified model of a tutorial with one teacher and one student.
So wherein there is a machine which will be having a program, and there will be short MCQs. It is not a computer, it is a machine. Okay, so there will be question displayed, and like a MCQ they have to select A, B, C, D, and they have to just scroll it down, the next question comes. And now the great, or you can say the next version of this, what we are having is, you all know Byju's? So Byju's is following same technique of program instruction. There will be set of videos shown to the student, and there will be a questionnaire. If the child passes that questionnaire, he goes to the next level, otherwise it starts from the one level. Okay. So the next common method is program, the computer-based learning, the previous slide. So you all know that computer, everybody is aware of computer. I don't think so this generation anybody has to have an introduction of what is computer. It will be rather whether you have Windows 10 or you have, the higher versions. So basically this is going to help us to use the technology in class. It is not only the PowerPoint presentations, there will be short videos, online discussions, so all this will be with the help of or use of computers. Okay, next. Next is problem-based learning. You heard of this word, problem-based learning? Okay, problem-based, the term itself can tell you that it is based on problem. So problem has to be given to the students, and based on that they will be learning. Okay, so what is PBL is combines critical thinking, problem solving skill, and the students gets an habit of inquiring new thing or finding out new thing. Okay, so here it is just opposite to the traditional learning method, where students are assigned a problem. They have to identify what are the solutions are there, and there will be based on that activities to solve that problem. Okay, next. So there are different steps which are done in PBL. First you need to give a scenario, then there will be a brainstorming session where they'll identify what are the gaps, and then they'll be using their critical knowledge to self-directed learning, which will help them for that, and they'll assemble the knowledge, and they'll be analyzing of that whole result or whatever data they have gathered. Okay, so for example, if you get a scenario that there is a patient who has come with fever. Okay, now the patient is under investigation. So what things comes to your mind if there is a fever, because of what underlying causes it will be? Fever is, you all know fever, you handle patient with fever. Okay, so fever is a sign of infection. Okay, you all know there are types of fever. Okay, so there is a continuous fever, there is an intermediate fever. So when there is an intermediate fever, the fever is every night rising. It may be because of which case? Intermediate fever, a common or classical example of malaria. Continuous fever, whether it is acute, whether it is chronic. Acute, it can be viral, it can be bacterial. Chronic, if the child has throat sore, it can be rheumatic fever. Okay, so these are the gaps which you need to identify what are the symptoms of child is the patient is having, and that's how you are going to learn and identify after assembling all this information, that why there is a fever. Understood? So this is how the scenario or PBL is going to help us to learn from that particular condition. Okay, next is blended learning. Now already previous speaker already spoken about blended learning. Blended means online and offline, blending two or more things. Okay, so blended learning is typically classroom learning and online learning, both are blended. Okay, so it is also called as face-to-face learning plus online learning. Okay, next. There are two classes for blended learning. One is station rotation model. Station rotation in the sense there will be different stations will be prepared and the students will be rotated. Okay, like for example, there will be one station where the students is learning online, second session where student is given some physical activity and they are doing on a table. There will be third session where there will be teacher will be along with the students and the students will be learning from that teacher, taking an instruction. Okay, I think all are settled. The back side there is so much of disturbance. Okay. So second common method is flexed model, where actually it is more of online learning, but there will be set of instructions given by teacher. So teacher will be preparing a videos which are based on instruction and then they will be learning through. So can you click on the example, the video. So there is a video of flex model, how does it work.
Whether it be math or history or physics or whatever, breaks it up into small, easily digestible items of information,
The pH value
arranges these items in a logical sequence,
So
and then feeds the first
what
one.
is the pH value of blood. It shows that it's 7.4 approximately. What happens when I add water to it? Let's observe the pH value. Yes, the pH value was decreasing when I've taken chicken soup. What is the pH value here? It is 5.80. Let us try adding water to it and observe the pH value. What happens to the pH value of the chicken soup? You can observe here the pH.
Okay, so there is set of instructions which are already given by a teacher along with that online teaching. So teacher may not be directly face to face with the student, but she is teaching at the back with using technology. So that is what is flex model. Okay, so these both models can be used as blended teaching. So blended learning, or you can say it is very much becoming adaptive because of COVID. You all had online classes during COVID-19. Yes, okay. You are enjoying that? Now physical is more, difficult, hai na? Okay, so we can have both combination. That was a method can be done like for the people, even like conferences also can be on blended method. Like those who want to stay at, those who are far and wants to still attend can be attending, and still people like you will be physically be there. Okay, next common method is flipped classroom. The word itself says it is flipped. Flipped in the sense it is just opposite or it is reverse. So this method is typically where what usually happens, you come to the class, the teacher teaches you, and that's how you learn. What happens in flipped classroom? You first learn outside the class and then you come to the class. Is it wonderful or boring? No reaction? You already know about the topic, you learn about that topic, then you come to class and then you are hearing me. So that is more good, or previous one is better? Just come and sit, let the teacher say whatever she wants to say. I am here to listen passively. What is good? classroom? Yeah. Supposed to be good because this is just opposite to the traditional method where the teaching can be happening or the learning can be happening outside the classroom as well. Okay. So the next, there are 4 pillars of flipped classroom. Next. The first is flexible environment. The environment is very much flexible because they are first learning anywhere, anytime out of the classroom. Secondly, the learning culture. The learning culture here, we are not only emphasizing on, the teacher has to be giving the knowledge, it will be from student point of view also what they want to learn. There will be intentional content. Even though you are learning outside the classroom, it is not anything you can surf on or browse on your Google. It has to be intentionally given. The teacher will tell you which topic, where to search